I'm Russell McMurray, the Commissioner of the Georgia Department of Transportation, and I welcome you to your career at the Georgia Department of Transportation. I know each and every day you will find the work at Georgia DOT to be challenging and rewarding. In doing so, you will find that you contribute to make transportation better for all Georgians and those who pass through this great state. One of the great things about the Georgia Department of Transportation is we really foster an atmosphere of collaboration and innovation. That is, working together as a team in a collaborative manner and always focusing on where we can innovate through technology and through just one-on-one process improvement. We're always looking to make it better. Here at GDOT, I always like to say, let's figure out how to make it better. Because if each of us, each day, figures out how to make it better, what a great outcome that is for the state of Georgia. So today is a wonderful day. You have a lot of information coming your way, so pay attention. Always ask for help if you need it. Feel free to reach out. Again, we're here as part of the team. I look forward to meeting you personally one day and wish you all the best with your career here at GDOT.
Hi, I'm Nicole Glenn, the Recruitment Manager for the Georgia Department of Transportation. Welcome to New Employee Orientation and the first day of your career with GDOT. We are honored that you have chosen GDOT as your employer. The health and safety of our employees is our top priority. Due to the impacts of the COVID-19 pandemic, we have created a virtual version of our new employee orientation to ensure we are meeting social distancing guidelines and living in contact with our employees. If at any time during this orientation you need assistance, please reach out to me. When you report to your office, you will be given a GDOT Wellness Kit. The kit will contain a mask, hand sanitizer, a paper bag to store your mask, and guidelines to stay safe in the workplace. As a reminder, please practice social distancing. Stay at least 6 feet away from others. Do not gather in large groups. Wear a mask when you're in common areas of the office. Wash your hands and sanitize your workstations frequently. If you're feeling ill or come in contact with someone who has been sick, please stay home and contact your manager immediately. Today, you'll hear from our safety office, employee relations, the benefits team, and our HR generalists. Each presenter will have a pre-recorded presentation. If you have any questions regarding the information shared, please reach out to the contact provided. We are here to help. We are delighted that you've chosen to work with GDOT. Welcome to the team where you'll have the opportunity to collaborate and provide innovative solutions for the state of Georgia.
Hello. My name is Monique Horton, and today I will be going over your 2022 benefit elections for health and flexible benefits. I will start with the health insurance for your 2022 plan options. As we all know, the Affordable Care Act was passed to make sure that employers were offering affordable health care to their employees. Through SHBP, GDOT is in compliance. However, starting 2019, there is a $0 penalty for not having your health insurance for the tax year. All benefits are effective 30 days after employment. So if you start on the 1st of the month, your benefits go in effect the 1st of the next month. However, if you start on the 16th of the month, your benefits will not go into effect the month after that. So if your first deduction will be on the 24th of the month, if you have a deduction on the 24th of September, that means your benefits go into effect on October 1. However, if you have your first health deduction on October 24th, that means your health insurance does not go into effect until November 1. To make your online elections for your health benefits, please visit myshbpga.adp.com. Since you are a first-time user, you will need the one-time registration code of SHBP-GA. There is a new look to the health insurance website. If you have any questions, please feel free to give me a call. Your member services options for SHBP are, you can send them an email at shbpservicecenter at adp.com, or they have a mobile app now. Please access your App Store for iPhone user or Google Play Store for Android users and download the ADP Solutions mobile app. You can make your online elections from your cell phone now. Also, SHBP has introduced Skip the Phone campaign. If you visit this website, it will give you a step-by-step navigation on how to navigate through your SHBP enrollment portal. If you need to contact SHBP at any time, they are available Monday through Friday from 8:30 a.m. to 5 p.m. Eastern Standard Time. Your 2022 planned elections for SHBP are Anthem, Blue Cross Blue Shield, HMO, and HRA, Kaiser, Regional HMO, where you have to live or work within the 27 Metro Atlanta counties. And last but not least, we have United Healthcare, HMO, and HDHP plan. For the 2022 plan year, Anthem, Kaiser, and United Healthcare are offering telemedicine or virtual visits. For Anthem, there is an app called Live Health where you would download and select your doctor that you prefer to see. You will not be charged a copay until after you have seen a physician. For Kaiser, for telemedicine appointments, you would go through your KP Now portal. If there is needed an appointment, you can make the appointment through that portal. For United Healthcare, please download United Healthcare Help for Me app for virtual visits. You will not be charged a copay until after you have seen a physician. For the 2022 plan year, co-insurance waivers are granted for chronic illnesses such as diabetes, asthma, or heart conditions. If you fall under any of these, please contact your selected provider for information on how you can get enrolled into this program. A few terms and conditions and definitions that I often get. What is a copay? A copay is a flat fee in which you would pay before you are seen by the physician. Coinsurance is the portion that you will be responsible for after your deductible has been met. A deductible is the amount that you are responsible for before the insurance starts paying its portion. Out-of-pocket max is the maximum amount that you will spend out of pocket towards medical, deductible, copays, coinsurance, and pharmacy costs. After out-of-pocket max are met, the insurance plan will cover at 100% for the remainder of the year. Eligible expenses are expenses covered under your health plan. A primary care physician is a doctor who would have a study in field as for family medicine, general practitioner, internist, obstetrician, or pediatrician. A specialist is a doctor that specializes in a certain field, like a endocrinologist or a ear, nose, and throat doctor. In-network providers are providers who have agreed to negotiated rates. Out-of-network providers are providers that have not agreed to negotiated rates and may not accept your insurance. However, you will be subject to paying a higher cost. A quick tutorial on how to choose a plan. So for the statewide HMO, which is Anthem and United Healthcare, you have access to providers nationwide. Copays are associated with certain services. Copays count towards your out-of-pocket max, however, do not count towards your deductible. and you have access to in-network providers only except for emergency care. The regional HMO, which is Kaiser, it is a copay only option. There are no deductibles or coinsurance associated. All of your medical, pharmacy, and wellness visits will be done under the Kaiser roof. However, they do have a higher out-of-pocket max, and you must live or work within the 27 metro Atlanta counties. HRA, which is administered by Anthem, they are a credit-based insurance company that will help offset your medical and pharmacy costs. You do have access to in-network and out-of-network providers. You can get a flexible savings account to help offset any out-of-pocket costs. However, there are no copays. You only pay deductibles and co-insurance. And depending on your tier, because the HRA is tiered off into gold, silver, and bronze, that will dictate how high your deductible is. The gold plan, you will have a lower deductible. However, the silver plan, you will have a higher deductible and a lower premium, but the gold plan, you will have a higher premium. HDHP, which again is the high deductible health plan that is administered by United Healthcare. There are lower monthly premiums. You have access to in-network and out-of-network doctors. You also can get a health savings account to help offset any out-of-pocket costs. There are no copays associated with this plan. However, you have to meet deductibles and co-insurance, and these are higher deductibles with a lower monthly premium. The Anthem or United Care HMO, these plans are good for members who like predictable costs when visiting the doctor, have in-network physicians, and also good for those that want access to doctors nationwide. The Kaiser Regional HMO are good for members who do not like to meet deductibles, who will only be responsible for paying copays for any visits, and those that like to have all of their medical, pharmacy, and wellness services under one roof. Anthem, HRA, are good for those who want access to in-network and out-of-network doctors. You are given credits at the beginning of each plan year by SHBP. The gold level, you would pay a higher copay but a lower deductible. With the bronze plan, you will pay a lower monthly premium with a higher deductible. HDHP, which is United Healthcare, you have access to in-network and out-of-network doctors. You will save money on your premium. However, remember, it is a higher deductible that must be met before the insurance company pays their portion. So in this scenario, we're going to say that you have not visited the doctor at all for the plan year. Each scenario breaks down how the plan will process your doctor's visit. For the Anthem HMO, it is said that the negotiated rate for insurance and for a doctor's visit will be $125. So once you go to the doctor and they run your insurance, if you have the Anthem HMO, you will be responsible for a $35 copay. That $35 counts towards your out-of-pocket max, and that is with United and Anthem. The regional HMO, which is Kaiser, that is a copay-only option. So when you go for a sick appointment, you will be responsible for a $35 copay before you're seen by the physician. For HRA, which is Anthem, this scenario, we're using the silver plan. That is the middle plan of the HRA options. Your deductible is $2,000. Your out-of-pocket max is $5,000. But SHBP has given you 200 credits, which are dollars, towards your plan. So your doctor's visit is $125. At your doctor's visit, you will not be responsible for paying any out-of-pocket costs because the value of that visit, which is $125, will be deducted from your 200 credits that you were given by SHBP for the plan year. That leaves you with the remainder of 75 credits for the rest of the year. But we will go over later in the presentation how you can earn additional credits to help offset any out-of-pocket costs. A good thing is that the $200 that is going to the $125 that you're paying for the sick appointment goes towards your deductible and your out-of-pocket cost. For the HDHP plan, since it is the high deductible health plan and for an employee only, the deductible is $3,500. Remember, you have to meet your deductible before the plan pays anything. So at the time of that sick appointment, which is a value of $125, you would have to pay $125 before you are seen by the physician. That $125 does decrease your deductible and out-of-pocket cost. For the second scenario, we're going to view outpatient surgery. For outpatient surgery, it has been deemed that it will cost $2,000 for the physician and the facility. This is before insurance is applied. For the statewide HMO, which again is Anthem and United Healthcare, you have a $1,300 deductible, a $4,000 out-of-pocket max with 20% co-insurance. So that means that you will pay the first $1,300, which is your deductible. You will pay 20% of the remaining balance. So that's $18,700 of the remaining, plus 20% of the co-insurance. After you have paid the $1,300 plus the $2,700, the rest of the year, the insurance company will cover you at 100%. For the regional HMO, which is Kaiser, since they are copay only, you will be responsible for paying a $100 copay before you receive the service. The $100 copay goes towards your out-of-pocket max. The Anthem HRA, in this scenario, we are using the silver plan again. The deductible is $2,000. Your out-of-pocket max is $5,000, and you are given the 200 credits by SHBP. So in this scenario, you have not used the 200 credits, nor have you paid anything towards your deductible or out-of-pocket max. This means that you will be responsible for the $2,000 deductible and 20% of the remaining balance of $18,000. Since your out-of-pocket max is $5,000, you would only pay the $2,000 and the 20% of the copay, but your maximum amount for this $20,000 surgery will be $5,000. So you would basically pay your out-of-pocket max. The remainder of the year, everything else is covered at 100%. For the HDHP plan, this is the high deductible health plan. Again, before any amount of money is paid by the insurance company, you have to meet the deductible. So you will be responsible for the $3,500 deductible. They have 30% co-insurance. So the $3,500 deductible would decrease the amount that you have to pay. So it's $16,500 is the 30% of the copay, which is $4,950. So you would pay your out-of-pocket max of $6,450. After that, everything else is covered. So a quick recap for the Anthem HMO and HRA. For the HMO, you have co-pays, co-insurance, deductibles. All preventative care is covered at 100%. Your medical and pharmacy costs count towards your out-of-pocket max. There are no referrals needed for specialists. You can earn incentive credits. They do participate in the disease management program, and your credits can roll over from year to year. The HRA plan, that is gold, silver, and bronze, you have co-insurance, deductibles, 100% for preventative care, Your medical and pharmacy costs count towards your out-of-pocket max. You have access to in-network and out-of-network physicians. There are no referrals needed for specialists. The plan does come with preloaded SHBP credits. You can earn additional credits. They also participate in a disease management program, and your credits can roll over from year to year. United Healthcare, HMO, and HDHP. With the HMO, you have copays, coinsurance, deductible, preventative care is covered at 100%. Your medical and pharmacy costs count towards out-of-pocket max. There are no referrals necessary for specialists. You can earn incentive credits. They do participate in a disease management program, and credits do roll over from year to year. For the HDHP plan, you have coinsurance, deductibles, preventative care is covered at 100%. Your medical and pharmacy costs count towards out-of-pocket max. You have access to in-network and out-of-network doctors. There are no referrals needed for specialists. You can earn incentive credits. However, in order to use your incentive credits, you must have already met your deductible. They do participate in a disease management program, and credits can roll over from year to year. With Kaiser Regional HMO, they only have copays. Again, you must live or work within the 27 metro Atlanta counties. Preventative care is covered at 100%. Your medical and pharmacy costs count towards your out-of-pocket max. No referrals needed for specialists. However, referrals will be needed for certain specialists. You earn a reward card with Kaiser, and credits do not roll over from year to year unless you were previously enrolled in another SHBP option before you selected Kaiser. If you are planning to retire, please have health insurance 1 year prior to your retirement. So if your retirement date is January 1 and you have not had health insurance for the previous plan year, please make sure you sign up for health insurance during open enrollment of that year before you retire. For the 2022 plan year, Anthem and United Healthcare have partnered with CVS Caremark. However, this does not mean that you must get your prescriptions filled at CVS. You may go to any of your preferred pharmacies to get any prescriptions filled. This just means that they have negotiated your rates at a reasonable cost. For any Kaiser members, your pharmacy elections will have to be done at a Kaiser facility. If you take your prescription any place other than a Kaiser facility, you will be subject to pay the full cost of the prescription. What is a wellness incentive? Wellness incentives from Anthem and United Healthcare help offset your copays, coinsurance, and deductibles. How do you earn your wellness incentives? SHBP has partnered with ShareCare for your wellness incentives for the 2022 plan year. All wellness activities must be performed from January 1, 2022 through November 30th, 2022. Once you have completed your required activities, you will be eligible for either a 480 incentive points that will roll over into your healthcare spending account, a $150 Visa gift card that can be spent anywhere Visa is accepted, or last but not least, you will be given a Visa gift card to Walmart that must be used in the Walmart Vision Center or pharmacy. The activities that you must complete in order to be eligible for any of the incentives, you will complete a real age test, a biometric screening. Those you will receive 120 points per activity. To reach the additional 240 points, you can either sign up for a telecoach pathway, which is a phone call that you will receive from SHBP. You're only required to do 4 for the calendar year. However, if you schedule more, you feel free to schedule as many as you would like. Also, when you log into your ShareCare app, you will have challenges that you must complete every month. Once you have completed at least 2 of these challenges, you will receive the additional 240 points, just like if you do the 4 coaching calls as well. This is available to you and any covered spouse. Again, the incentives that you're working towards would be a $150 Visa gift card that can be used anywhere Visa is accepted, a $225 Walmart gift card that can only be used at the pharmacy or vision center, and last but not least, you can choose to roll over the entire 480 well-being incentive credits to your medical pharmacy spending account. Kaiser has a similar program, but you will do this through your Kaiser portal. You must also complete a health assessment and know your numbers. You will have to also participate in age-appropriate cancer screenings and do an online course. Once you have completed this, and this is also available to you and a covered spouse, once you have completed your well-being incentive rewards from Kaiser, you and a covered spouse are eligible for a $500 gift card that can be used anywhere that MasterCard is accepted. For the 2022 plan year, TRICARE is offered through SHBP. There are no changes in the premiums. You must have your ID number in order to sign up for TRICARE. Peach Care for Kids is offered to state employees. This is up to children age 19. If this is something that you're interested in, please go to the Department of Community Health and fill out their application. They are the determining factor if you are approved or not. Here are a few helpful contacts. Also, again, if you have any problems getting into the SHBP portal, please contact myself or SHBP. Remember that if you are covering any dependents, whether that be a spouse or a child, they will be put in a pending process. So if they're put in the pending process, you will receive something from ADP Dependent Verification via mail. Please open it and process as soon as possible because it is deadline sensitive. For dependents, it usually asks for something like your birth certificate. For a spouse, I think the most common is your marriage certificate. You as the employee are automatically approved for health insurance, but anyone outside of yourself will be pending. So please, please, please look at your deadlines. If they have not received the information by the deadline, your dependents will be dropped. Now I will go into your flexible benefit 2022 plan options. To make your online elections for your flexible benefits, please visit gabreeze.ga.gov. You will click the Are You a New User link. It will ask you the last 4 of your social and your birthday. After you have inputted that information, please enter all password retrieval options, whether it be entering a phone number or email address, and please set up your security questions and your phone PIN number. This will help you access the website for future use. For the 2021 plan year, your flexible benefit options are Cigna and Delta Dental for your dental insurance, WageWorks for your healthcare and dependent care account. MetLife is the administrator of all life insurance policies and now our legal plan as well. Unum, long-term care. The Standard, short-term and long-term disability. Aflac, critical illness. And last but not least, we have Anthem Blue View Vision for your vision insurance. Cigna and Delta Dental are the dental providers for the 2022 plan year. Delta Dental has two options. They have the Select and Select Plus plan. For the Select plan, there is a $500 maximum coverage for the year, and there is a $2,000 maximum coverage for the year for the Select Plus plan. The major difference between the Select and Select Plus plan is that with the Select Plus plan, you will receive a $2,000 orthodontia allowance for any covered member. For Cigna, it is a HMO plan. There are no maximum coverage for the year. Anthem Blue View Vision is the vision insurance. It has a Select and Select Plus plans. The copays differ in both plans, and I think one of the most prominent differences in both plans with the Select plan, you are given a $130 allowance towards the cost of frames twice every 2 years. There is 20% off the remaining retail balance. With the Select Plus plan, you are given a $150 cost towards the cost of frames every year, with 20% off of the remaining balance. MetLife is the administrator of all life insurance policies. For employee life, we offer 1 to 10 times your salary with a maximum coverage of $2 million. As a new hire, you are given the one-time opportunity to choose designated levels of insurance as a new hire before you have to provide medical underwriting. Coverage amount for one time up to $200,000 is guaranteed. Also associated with the life insurance, you have premium waivers if you become disabled. They do also allow you to do a will preparation. They will partner with Hyatt Legal to help you complete a will, living will, or power of attorney for you and your legal spouse at no charge. They also have estate resolution services. This gives your beneficiaries the support of, again, Hyatt Legal if they have problems with your estate. These are in person or via telephone visits. Again, for employee life, it is 1 to 10 times your salary. Spouse life is up to $250,000, and child life, $20,000. Accidental death and dismemberment, this is 1 to 10 times your salary as well, with a max coverage amount of $2 million. If this is something you are looking into, you will have to complete the statement of health online. This will be done after you have completed your Georgia Breeze enrollment. The Standard is the administrator of the short-term and disability insurance. For short-term disability, this is a 6-month disability plan that will pay you on a weekly basis. It is not for a permanent period of time. It will replace 60% of your salary on a weekly basis. There is a 7-day and a 30-day waiting period. The maximum amount of money each week that an employee can earn from short-term disability is $1,000. For long-term disability, you have to be out of work for at least 6 months or 180 plus days to be eligible. This only kicks in, again, after you have been out for 6 months. If you enroll as a new hire, you will not be considered a late enrollee. If this is an option that you are thinking about signing up for later during open enrollment, you will be considered a late enrollee, saying that if you become disabled, and even if you chose a 7-day waiting period, and you didn't sign up for short-term disability when you became employed with the state, you will have to wait 60 days before your disability insurance pays you, even if you only chose a 7-day waiting period. If you do not sign up for long-term disability as a new hire, you will not have the option for it after being a new hire. Specified illness through AFLAC, we have coverage for employees and spouses, both up to $50,000. If you get specified illness for yourself, your children are covered at 50% at no cost. For the specified illness, if you have a heart attack and you chose the $50,000 coverage level for your heart attack, you will receive a check for $50,000. If you have another heart attack at least 12 months past the first one, you will only get half of the value of your coverage level. So again, if you chose the $50,000, your check will only be for $25,000. Long-term care administered by UNUM. What is long-term care? This is care that you, your spouse, your parents, or your parents-in-law have access to help you with your day-to-day living. This can help you with bathing, dressing, going to the bathroom, eating, and if you suffer from cognitive impairment such as Alzheimer's. Again, you, your spouse, your parents, and your parents-in-laws are covered. If this is something that you're interested in for yourself, it can be payroll deducted. However, if you're interested in anyone other than yourself, such as a family member, you will be direct billed by UNUM and you will pay UNUM directly. In your Georgia Breeze enrollment portal, you will not see a link for you to sign up for UNUM. Please visit unuminfo.com/SOG to get your rate calculator and the enrollment portal. For your legal insurance, MetLife Legal Plans is the administrator. You have Select, Select Plus, and Select Premium options. If you choose a Select Premium option, you will have all options under Select Premium as well as Select and Select Plus plan. If you choose Select Plus, you have all options under Select Plus and the Select plan. However, if you just choose the Select plan, you only have the options available under the Select plan. This is a nationwide benefit that is available to you 24 hours a day, 7 days a week. For your flexible spending accounts, WageWorks is the administrator. For the healthcare spending account, the annual max is now $2,700. The healthcare spending account is an account where you would designate an annual amount to contribute, and this could help offset deductibles, co-pays, prescription costs, physical therapy, and contact lenses and glasses. Whatever amount you decide to select for the year is available to you on the effective date of your benefits. So if your start date is on the 1st of the month and you select the healthcare spending account, whatever amount you selected is readily available to you the 1st of the next month. Please make sure you retain all receipts because sometimes WageWorks will require a copy. For the dependent care spending account, the annual max amount is $4,992. This is a little bit different than the healthcare spending account. This service is a pay up front and get reimbursed later. And with the dependent care account, it can help offset your after school costs or daycare costs. You would pay your provider upfront, receive a receipt, and then upload that receipt into your WageWorks account. Once you have reached the amount on your receipt, you will receive a check in the mail for the amount of that receipt paying back to you. You will not be reimbursed for any expenses until you have that amount in your account. So on the 24th of each month, which is a pay period, the 1st to the 15th, you will see deducted from your check ERS, 401k, if you choose healthcare dependent care spending accounts, and health insurance premiums. The reason that you see the healthcare and dependent care accounts is because, remember we talked about putting the monthly amount? This will automatically split it up into 2 payments that you will see on the 24th and your 9th check. There's also a $3.20 administrative fee that is also split in half that's added to your premium amount. On the 9th of the month, you will see deducted from your paycheck your ERS, your 401k deductions. If you choose a healthcare dependent care spending account, all other flexible benefit premiums, and anyone who works in the Go office, your parking. These are a few numbers associated with each insurance company. Again, I am Monique Horton. I'm the benefits coordinator here. If you have any questions, please feel free to give me a call at 404-631-1505, or I can be reached via email at mhorton@dot.ga.gov. Welcome to GDOT.
Welcome to GDOT and congratulations on your new job. We are so glad that you chose GDOT as your new place of employment. Well, as part of your new employment orientation, the Employee Relations Department has a few things we'd like to share with you. We are so glad that you're on our team and hope that you find this as a wonderful place to work. So you may be asking yourself, what exactly is employee relations, right? Employee relations vision is to promote a confidential, supportive, and neutral place for GDOT employees and managers to discuss confidential issues and concerns. Our mission is to provide professional HR services to employees and managers through fair, consistent, and transparent communication and application of GDOT policies, procedures, by enhancing and encouraging effective communication, conflict resolution, and employee engagement activities. What are we going to talk about today? So glad you asked. We are going to talk about drug-free workplace, sexual harassment, family medical leave, preventing workplace violence, and standards of conduct. So we will start with the drug-free workplace policy, which is covered under policy number 2290-1, and it reads, in accordance with the Federal Drug Workplace Act and the Georgia Drug-Free Public Workforce Act, it is the policy of the Georgia Department of Transportation to maintain a drug-free workplace. The department will make a good faith effort to ensure that a drug-free workplace is maintained. Our objectives: at the end of this training, employees should be familiar with the drug-free workplace policy and aware of the dangers of alcohol and drug abuse. Employees should understand the drug-free workplace policy, the prevalence of alcohol and drug abuse and its impact on the workforce and the workplace, how to recognize the link between poor performance and alcohol and or drug abuse, At the end of this training, employees should be familiar with the drug-free workplace policy and aware of the triggers of alcohol and drug abuse. Employees should understand the drug-free workplace policy, the prevalence of alcohol and drug abuse and its impact on the workplace, how to recognize the link between drug use and poor performance, the progression of the disease of alcohol and drug addiction, and the types of assistance that may be available. This policy exists to protect the health and safety of all employees, customers, and the public, safeguard employer assets from theft and destruction, protect trade secrets, maintain product quality and company integrity and reputation, and to comply with the Drug-Free Workplace Act of 1988 and other applicable laws. You may ask, why is it important to have a drug-free workplace? Particularly when we have some drugs becoming legal that weren't previously legal in our society. And what you should know is that impaired employees are more likely to put themselves and other coworkers in harmful situations. Drug-free employees are more productive. Impaired employees have poor decision-making abilities. It improves employee morale when we have a drug-free workplace. And illegal drug activity is a serious threat to public safety and welfare and the public health. And also, it helps preserve and present a good organizational image for us to have a drug-free workplace. What does drug abuse look like in the workplace? Good question. 8.8% of full-time employees are drug users. 9.4% of part-time employees are drug users. More than 70% of those abusing illicit drugs in America are employed, and most of those are binge drinkers. 22.5% of people say that they have used drugs or alcohol at work. 2% of workers admit to being drunk at work weekly. 3.3% of workers admit to being high at work every week. And 5.4% of workers admit to using medical marijuana in the workplace weekly. Lastly, 13.3% of male and 7.3% of female employees admit to purchasing something to help them pass a drug test. So what are the costs of substance abuse in the workplace? It costs employers $81 billion a year. 25.5 billion of those costs is in lost productivity. 25 billion is in increased healthcare. 80% of drug users report their drug use by their drug use by stealing from work. 70% of Americans who use illegal drugs are currently employed in the workforce. And drug use is positively correlated to, which is to say, as the drug use increases, so is there an increase in workplace violence, absenteeism, staff turnover, and equipment breakdown, which means they were probably trying to use the copier while they were impaired and broke it. The Federal Drug-Free Workplace Act of 1988 requires all employers that receive federal funds to notify employees that alcohol and drug use, possession, and/or sale in the workplace is prohibited. Encourage employers to set up a method for employees who have problems with alcohol and other drugs to voluntarily seek help, and we'll talk about that later. Provide methods for reporting drug convictions and arrests, which we will also talk about, and develop a policy with resulting circumstances for violations, which we will get into as well. What is GDOT's response to this law? Well, we have drug awareness procedures. We have a policy that prohibits drug usage. We have the Employee Assistance Program, and we have random and reasonable suspicion drug testing, drug and alcohol testing. Here are some things you should avoid. Avoid illegal and illicit drug use while at work or in travel status. Avoid drinking alcohol while at work or in travel status. Avoid prescription drugs that can impair performance. Avoid using someone else's prescriptions. Avoid using drugs or alcohol while operating vehicles or equipment. And avoid possessing or distributing alcohol or drugs while on GDOT property in a GDOT vehicle, while wearing GDOT paraphernalia, or while responsible for the safety of others. Reporting drug arrests and convictions, employees are required to make every reasonable effort to personally contact the appropriate district engineer, office head, or their designee of any criminal drug arrest or convictions within 5 calendar days of the date of the conviction. The types of testing are pre-employment testing, so before you're hired. Random testing, we have a company that chooses employees randomly and they test them. Return to duty testing, so if you receive an drug alcohol test and the score is below 0.4 but above 0, you may be asked to do return to duty testing. Follow-up testing, post-accident testing, all employees who are in car accidents are asked to do a drug test. It is standard procedure. And reasonable suspicion testing. If your supervisor or above suspects that you are under the influence, they can send you for reasonable suspicion right away. Alcohol and drug testing may be required when it is determined that reasonable suspicion exists. The determination that reasonable suspicion exists must be based on specific contemporaneous articulable observations concerning the appearance, behavior, and speech or body odors. After notification has been made, the employee must be transported immediately to the collection site for an alcohol and/or controlled substance test. The consequences of drug testing. So if you are tested and your drug test comes back with 0, congratulations, you may go back to work. If it comes back between 0 or 0.02 and 0.039, you will be removed from work for the remainder of the day without pay. If it is 0.04 or higher, you will be terminated immediately, and there is the possibility that you will be put on the do not rehire list, but you will be disqualified from employment for 2 years. What if I refuse to test? I'm so glad you asked. Well, the results are the same as if you test 0.4 or higher. You will be disqualified from employment for 2 years and likely recommended for do not rehire. What are your responsibilities as an employee? Well, the first is to know the policy, the second is to abide by the policy, and the third is to immediately report drug-related arrests or convictions. Let's answer a few questions. What is the minimal breath alcohol concentration for GDOT employees who fail an alcohol test? You remember? If you said 0.04, you are correct. During a scheduled lunch break away from the office, you drink 2 beverages containing alcohol. Is it possible to fail a breath alcohol test? What do you think? If you said yes, you are correct. It depends on the beverage, the alcohol content, body weight, and tolerance. However, drinking at work is highly prohibited. You strained your back lifting a piece of equipment, but because you are a wonderful employee, you want to finish your workday. Your coworker offers you her prescription Tylenol with codeine. Is that okay? What do you think? If you said no, you are correct. Do not take anyone else's prescriptions. Plus, codeine can test positive in a drug and alcohol test. More questions. Can your supervisor send you for reasonable suspicion testing if a coworker he or she trusts tells him or her that you are under the influence of alcohol or substances? No. The supervisor has to directly observe the suspicious behavior and then they can send you. Can marijuana really last in your system for up to 30 days? Who knows this one? The answer is yes, it absolutely can. If I'm arrested for possession of drugs on the weekend, do I have to report it to GDOT since it's on my own time? You do. You have to report it, and you must report it within 5 calendar days. Absolutely. If I'm arrested for drug trafficking, can I use my annual leave while I'm in jail? No, nine, nan, na, now, and cha. All of those mean no. All the no's. No, 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 and no. GDOT will not pay you while you're in jail. If you have any questions about any of this, please feel free to contact Scotty Mathis, Kimberly Sever, and Beverly Nash. Scotty Mathis takes care of districts 3, 4, 5, and 6. Kimberly Sever and Beverly Nash share the GO, OMET, MAU, SLB, districts 1 and 6, and the TMC. GDOT Sexual Harassment Policy number 2880-1 reads, the state of Georgia promotes respect and dignity and does not tolerate sexual harassment in the workplace. The state is committed to providing a workplace and environment free from sexual harassment for its employees and all persons who interact with state government. All state of Georgia employees are expected and required to interact with all persons, including other employees, contractors, and customers in a professional manner that contributes to a respectful work environment free from sexual harassment. This policy is intended to set standards for executive branch agencies, and employees in furtherance of this commitment and to protect individuals from sexual harassment and retaliation. There are layers to prohibiting sexual harassment. The first layer is the federal government. The federal government protects employees from sexual harassment under Title VII of the Civil Rights Act of 1964. It is here for your review, and I will give you a moment to read it for yourself. Know that the state also has a law that prohibits sexual harassment in the workplace, and GDOT has a policy that prohibits sexual harassment in the workplace. And on his first day as governor of the state of Georgia, Governor Kemp enacted an executive order prohibiting sexual harassment in the workplace.
Welcome to the Sexual Harassment Prevention Training for Employees provided by the Human Resources Administration Division of the Georgia Department of Administrative Services. This course helps you as an employee create a harassment-free workplace.
Hello, this is Governor Brian Kemp, and I'm honored to welcome you to this training. On my first day in office as Georgia's 83rd governor, I signed an executive order that requires mandatory sexual harassment training for all state employees, along with uniform standards for preventing, reporting, and investigating allegations of sexual harassment in the state's executive branch. Every employee will be trained to prevent and properly respond to harassment in the workplace. This course will walk you through our expectations to ensure a positive work environment in state agencies. Preventing sexual harassment and establishing clear guidelines on the handling of complaints and investigations are important responsibilities of state government. My executive order and this training set a high standard for workplace conduct. As governor, I will not tolerate sexual harassment in the workplace. This will ensure a safe, respectful work environment for all state employees and the constituents with whom they interact. We must join together in this important effort and continue our work to keep Georgia a wonderful place to live, work, and raise a family. Thank you for your commitment to a harassment-free workplace in state government.
This module covers the following topics: the purpose of the sexual harassment prevention training for employees, the learning objectives of the course. On January 14, 2019, Governor Brian Kemp signed an executive order to prevent sexual harassment in the executive branch of the government. While there are multiple types of workplace harassment, incidents of sexual harassment present unique challenges which warrant the increased emphasis and the implementation of a special approach to the prevention, detection, and elimination of sexual harassment. The executive order requires mandatory sexual harassment training for employees, supervisors, and managers, the creation of a statewide sexual harassment prevention policy, and development of standardized reporting and investigation methods. Under the executive order and the statewide sexual harassment prevention policy, agencies will require all employees, including part-time, temporary, and seasonal employees, to complete employee sexual harassment training on an annual basis. State agencies and their employees must take a proactive approach to creating and maintaining respectful workplace cultures to ensure adherence to state and agency policies and to remain productive. Sexual harassment is a destructive behavior that creates a hostile or offensive work environment. It damages the respect and dignity of the person being harassed. The statewide sexual harassment prevention policy prohibits all sexual harassment and is not limited to conduct that is unlawful under state and federal anti-harassment laws. The state of Georgia is committed to providing a safe and respectful environment that is free from sexual harassment. For this reason, it is every state employee's responsibility to demonstrate appropriate behavior, follow state and agency policies, and comply with the law. During the course, you will be presented with information that will help expand your knowledge and awareness of sexual harassment. The learning objectives of this course include the following: provide an overview of conduct prohibited by the statewide sexual harassment prevention policy. Provide examples of what may be considered sexual harassment. Provide guidance on how to report allegations of sexual harassment and retaliation. Highlight the state's reporting and investigative requirements and what you can expect during an investigation. Outline how you can help prevent sexual harassment in the workplace. This module covers the following topics: the statewide sexual harassment prevention policy definition of sexual harassment, forms of sexual harassment, examples of prohibited conduct. In the previous section, you reviewed that every employee should be concerned with preventing sexual harassment in the workplace. Sexual harassment is a destructive behavior that can result in lost productivity and the creation of a hostile work environment. It is prohibited by State of Georgia Executive Order, the statewide sexual harassment prevention policy, and it is against the law. The statewide sexual harassment prevention policy defines sexual harassment as physical, verbal, nonverbal, or visual conduct that is either directed toward an individual or reasonably offensive to an individual because of his or her sex. Some examples of such conduct or actions may include unwanted sexual attention, sexual advances, requests for sexual favors, sexually explicit comments, and other conduct of a sexual nature, whether it is direct or implied, by an individual who knows or reasonably should know that such conduct is unwanted and offensive. It also includes conduct that is hostile, threatening, derogatory, demeaning, or abusive, or intended to insult, embarrass, belittle, or humiliate an individual because of his or her sex. The following examples should not be considered all-inclusive of behavior which is prohibited. Physical not only includes overt actions such as assault or abuse, but also includes more covert physical touching in a manner not generally considered appropriate social touching. Verbal can include disparaging remarks about a person's gender, comments or jokes of a sexual nature, requests for sexual favors, or unwelcome sexual advances. Visual or nonverbal can include facial expressions, suggestive gestures, leering, and even can be vocal, such as making sounds or whistling. Sexual harassment can occur anywhere, such as online or other electronic platforms, which can include sharing sexually suggestive comments or media through post and social media platforms, emailing, texting, calling, etc. Off-site includes work-related social events, business travel, or unwelcome visits to a person's home or hotel room. Some examples of conduct specifically prohibited by the statewide sexual harassment prevention policy include, but are not limited to, the following: denying or threatening to deny, either directly or indirectly, an employment benefit or employment-related opportunity to an employee for refusing to comply with a sexually oriented request. Providing or promising directly or indirectly to provide an employment benefit or employment-related opportunity to an employee in exchange for complying with a sexually oriented request. Displaying or transmitting pornographic or sexually oriented materials, such as photographs, posters, cartoons, drawings, or other images, or storing or accessing such materials on state-owned equipment for personal use or consumption. Engaging in indecent exposure. Making obscene gestures, such as hand or bodily gestures. Making romantic advances toward an employee and persisting despite rejection of the advances. In the next module, you review who is impacted by sexual harassment in the workplace. This module covers the following topics: sexual harassment offenders, targets of sexual harassment, motivations for sexual harassment. To this point, you reviewed the definition of sexual harassment, its various forms, and some examples of prohibited behavior. In this module, you shift the focus of the program from what is sexual harassment to who may be affected by sexual harassment in the workplace. Just as sexual harassment is demonstrated through a variety of behaviors and situations, offenders appear in a variety of roles within and/or outside the organization. For example, an offender may be the complainant's supervisor, a supervisor in another area, a coworker, contractor, lobbyist, or even a member of the public. In addition, sexual harassment is not only a male harassing a female, it may include any gender combination of offender and target. For example, male to female, female to male, male to male, female to female. Keep in mind, a sexual harassment complaint or report may be made by bystanders or witnesses not directly targeted. For example, a group email or text including sexually explicit jokes and/or pictures could be considered offensive by one of the recipients. Another example may involve an employee repeatedly witnessing a coworker being touched inappropriately by another employee. This bystander could make a hostile work environment sexual harassment report. So, what is the motivation behind sexual harassment? A common belief is that sexual harassment is primarily about sex or sexual gratification. However, it can also be conduct directed at someone because of his or her sex, regardless of whether it is conduct of a sexual nature. An example is a male supervisor or manager that only berates female subordinates for mistakes, but not male subordinates. The research indicates sexual harassment is actually about exerting power over another person. Sexual harassment is the method used to dominate and control someone. This reality supports the fact sexual harassment often involves persons of unequal authority. Another possible cause for sexual harassment is the blurring of social and business behaviors. Employees should treat each other with the same dignity and respect in social settings or off-site work situations as they would in the workplace. Employees should always be conscious that sexual harassment can occur in any setting. Regardless of the cause, sexual harassment is prohibited in the state of Georgia. This module covers the following topics: types of unacceptable behaviors, how to recognize and report retaliation. In previous modules, you reviewed what sexual harassment is and the various forms and types of sexual harassment. You also reviewed how sexual harassment may come from anybody an employee encounters as part of his or her employment, and that sexual harassment is not only a male harassing a female, it can include any gender combination of offender and complainant. In this module, you look at behaviors which could escalate into harassment if not addressed promptly. These unacceptable behaviors are unprofessional and prohibited. You also review how to recognize and report retaliation should it occur. Unprofessional and prohibited behaviors can adversely affect morale and productivity and make it difficult for an employer to maintain a respectful, harassment-free workplace. Unprofessional behaviors consist of conduct which is offensive, disruptive, and disrespectful. Some examples of unprofessional behavior include gossiping, talking negatively about another employee without their knowledge, teasing, shouting, arguing, bullying, and calling people inappropriate or unwanted nicknames. As a reminder, such conduct could be considered sexual harassment if the behavior involves images, content, language, and/or jokes of a sexual nature. Unprofessional behaviors are unacceptable and can escalate into situations which could be considered sexual harassment. Creating workplace environments free of harassment also includes making sure that employees who file a complaint or report of sexual harassment are not subjected to retaliation. Retaliation is an act or omission intended to punish or otherwise negatively impact an individual for submitting or assisting with submitting a sexual harassment complaint or report, participating in a sexual harassment investigation, or for otherwise opposing sexual harassment. Agencies and employees are strictly prohibited from acts of retaliation. Employees who are found to have engaged in sexual harassment and/or retaliation in violation of the statewide sexual harassment prevention policy will be subject to corrective and/or disciplinary action, up to and including termination of employment. In the next section, you review how to submit a complaint or report and what to expect after its submission. This module covers the following topics: who should report sexual harassment, when to report sexual harassment, how to report sexual harassment. In the previous sections, we reviewed behaviors that are considered prohibited sexual harassment and retaliation in the workplace environment. The best way to stop sexual harassment is prevent harassing behaviors from occurring and report them when they do. This module reviews the who, when, and how to report sexual harassment and what expectations you can have after the investigation begins. So, who can report sexual harassment? Anyone can report sexual harassment. This includes the target of the harassment or a third party who observes behavior they find offensive. As a State of Georgia employee, you are strongly encouraged to promptly submit a complaint if you believe you have been subjected to sexual harassment or retaliation. You are also required to promptly report if you are a witness or otherwise have reason to believe that another employee is being or has been subjected to sexual harassment or retaliation. You may submit a complaint or report regarding sexual harassment or retaliation to your supervisor or manager, division director, agency human resources director, or other agency designees. To the extent any of these individuals are the alleged harasser or retaliator, you may submit a complaint or report of sexual harassment or retaliation directly to the Office of the State Inspector General. While written complaints and reports of sexual harassment or retaliation are preferred, you may submit a complaint or report verbally. If you verbally report sexual harassment or retaliation, the contacted person will document the facts of the incident in writing. A trained investigator will promptly investigate all reports of sexual harassment and/or retaliation. This investigator may come from within your agency or may be assigned by the Office of the State Inspector General. Reporting sexual harassment and retaliation in a timely manner is important and helps your agency take appropriate and immediate action when a sexual harassment or retaliation incident occurs. Keep in mind, if you submit a complaint or report anonymously, the agency will make every effort to investigate, but may be limited if sufficient information is not provided. In addition, the investigator may need information from you to do a thorough investigation. Consequently, it may become impossible for you to remain anonymous. Your agency and all parties involved in the investigation will make every effort to maintain confidentiality of the information you report. However, some information may be shared with agency officials and potential witnesses during the investigation. In addition, complaints and reports of sexual harassment or retaliation, investigative reports, final determinations, and other related documents eventually become subject to disclosure under the Open Records Act after the investigation closes. Conducting a thorough investigation takes time. If you are a witness or complainant, you may be asked for an interview to secure evidence such as voicemails, text messages, emails, etc., and possibly interviewed a second or third time. You must be honest and open about the facts of what occurred any time you are interviewed. Your agency may take interim measures while the investigation is ongoing. Interim measures are non-disciplinary administrative steps taken for ensuring alleged conduct does not continue and/or you are protected from retaliation. Examples of interim measures include changes to employment arrangements, work schedules, supervision, or other directives designed to protect all parties involved in the investigation. After an investigation begins, a report of findings is provided to your agency leadership within 45 calendar days. Your agency head may grant an extension past 45 calendar days if there are extenuating circumstances. Once the report of findings is issued, a final determination based on the investigative report is made by your agency within 21 calendar days.
The state of Georgia appreciates your time and attention for completing the annual sexual harassment prevention training. You can prevent sexual harassment and demonstrate a commitment to maintaining a work environment that is free from harassment.
Let's answer a few questions. Quid pro quo means something for something, something for me, nothing for nothing, or something for you. If you said something for something, then you are correct. It means if you do something for me, then I'll do something for you. If you give me a sexual favor, then I'll give you a promotion or something like that. A person that feels that they're being sexually harassed can A, tell the perpetrator they feel uncomfortable, B, report the issue to their supervisor, C, report the issue to HR, or D, all of the above. Which one do you think it is? If you said D, all of the above, you're right. Question 3. Bob and James work together every day on a maintenance crew. James is the prankster of the team and teases the guys by calling them Nancy, Shirley, and queer when they complain about having to work in the heat or the rain. This can be construed as sexual harassment. True or false? If you said true, you are correct. Lacey's been going around telling people in the office she observed Adam and Sarah in the conference room making out. This can be construed as sexual harassment. Is that true or false? If you said true, you are correct. Spreading rumors of a sexual nature about someone can be seen as sexual harassment. If you have any other questions about this issue, feel free to contact Kimberly Savera, Beverly Nash, and Scotty Mathis, but also Tara Jackson, who is our EEO specialist here in the GO. In your districts, if you're in the district, you also have a district EEO officer who will be more than happy to help you. Family Medical Leave Act. So GDOT's Family Medical Leave policy is policy number 2230-9, and it reads, the Georgia Department of Transportation will comply with the Family and Medical Leave Act of 1993 and its implementing regulations as revised effective January 16, 2009 and March 27, 2015. The purpose of this policy is to provide employees with a general description of their FMLA rights. The Family and Medical Leave Act is before you, and I will give you a moment to read it for yourself.
What's FMLA? FMLA stands for Family and Medical Leave Act. It's a federal labor law passed in 1993 that entitles eligible employees to take unpaid protected leaves for family and medical reasons while continuing group health insurance. Its purpose? To help professionals balance the demands of work life and family life. Basically, FMLA provides eligible employees with 12 weeks of unpaid leave each calendar year without threat of losing their job. It also requires that employers maintain health benefits as if the employee is still working there. And the cherry on top? FMLA ensures that employees can return to work without risk of firing or demotion. Eligible employees are able to take 12 weeks within a 12-month period for circumstances including the birth of a child, child care within the first year of birth, spousal care, child care, or parental care for a relative with a serious health condition, a serious health condition that prevents the employee from performing the essential functions of her job. FMLA exists in order to provide families the space that they need in order to care about their loved ones without agonizing over what's happening with their job security. Certain situations qualify for FMLA. The employee has a serious medical condition. The employee must care for immediate family with a serious medical condition, pregnancy, the birth and care of a newborn, placement or subsequent care of an adopted or foster care child, care of an injured service member. If your family member is a service member in the armed forces, there's additional coverage for care available. Covered service member is a current member of the armed forces. Care under FMLA for a covered service member includes a service member receiving medical treatment, recuperating from a medical treatment or injury with outpatient status, or a service member on the temporary disability retired list for a serious injury or illness. To see if you're eligible for FMLA, check with your employer, your HR department, or your state laws. To get started, check out our article on FMLA. We've laid out eligibility step by step and compiled a list of resources to help you get started.
So I have a few questions for you for FML. Employees are allowed to have how many weeks off under FMLA? Do you remember? Well, if you said C, 12, then you are correct. Employees must be a state employee for how long to be eligible for FMLA? A, 3 months, B, 6 months, C, 9 months, or D, 12 months? If you said D, 12 months, you are correct. Employees must have been present at work for a minimum of how many hours in the 12 months immediately preceding FML? Is it 20 months, B, months, C, 150 months, or D, 2,000 months? And the answer is B. Employees who wish to use FMLA are required to take all of their time at once. Is that true or false? That is actually false. We have what is called intermittent FMLA or intermittent FML, where a person can take time as they need it. If they have a chronic or ongoing medical concern or issue, they can take intermittent FMLA to address those concerns as they need them. If you have any further questions regarding this issue, please contact Frederica Preston in the GO, and she'll be more than happy to answer those questions for you. The Georgia Department of Transportation's policy on workplace violence is covered under policy number 2255-8, and it reads, the Georgia Department of Transportation is committed to the prevention of workplace violence and the maintenance of a respectful working environment. GDOT employees, supervisors, and managers are expected to use safe work practices, follow policies, procedures, and directives, treat fellow employees and all work-related contacts with dignity, respect, and fairness, and assist in maintaining a safe and secure work environment. So why address workplace violence? Well, according to the Bureau of Labor and Statistics, 18,400 workers in the private industry experienced trauma from non-fatal workplace violence in 2017. These incidents required days away from work. Of those victims who experienced trauma from workplace violence, 70% of them were female, 67% were aged 25 to 54, 71% worked in the healthcare and social assistance industry, 18% required 31 days or more away from work to recover, and 25% involved required 3 to 5 days of work to recover. According to the Bureau of Labor and Statistics, 458 U.S. workers were workplace homicide violent victims in 2017. Of those victims who died from workplace violence, 82% were male, 48% were white, 64% were aged 25 to 54, and 21% working in sales and related occupations. And finally, 19% were performing protective service activities. Here are some more statistics on workplace violence. Every year, nearly 2 million American workers report being victimized by workplace violence, and many more incidents go unreported. Overall, workplace violence costs employers more than $120 billion a year, according to estimates by the National Institute for Occupational Safety and Health. Also, the U.S. Department of Labor estimates that workplace violence costs 500,000 employees 1.2 million workdays every year, and that $55 million in wages are lost annually. So what is workplace violence exactly? How would you classify that? GDOT describes workplace violence as a deliberate behavior, act, or statement that would be viewed by a reasonable person to be harmful, potentially harmful, aggressive, intimidating, harassing, bullying, or unsafe, and causes or could cause direct physical harm to property or physical or psychological harm to another person. It includes a threat that carries an expressed or implied intent to cause such harm and occurs within the scope of workplace activity on or off campus of the workplace. Some examples of workplace violence include, but are not limited to, hitting, stabbing, suicide, shooting, rape, threats, intimidation, and harassment, and swearing and shouting. Workplace violence can be committed by coworkers, customers and clients, contractors, strangers, of course, homeowners, and personal relations, which means people who are related to GDOT employees who may come up to the job site or the office and harm that employee or another GDOT employee. 5 warning signs of escalating behavior: confusion, frustration, blame, anger, hostility, and inappropriate affect. So let's talk about these a little bit. Confusion is if someone is seeming like they don't quite understand what's going on. Again, I'm not saying that you should just call 911 right away, but it may be something that you want to keep your eye on. If someone is exhibiting frustration, the same is true. If a person is blaming someone else for their behavior, this may be a precursor to workplace violence. We know that sometimes angry people, people who display outward anger, can be violent, not always, but it does happen. Or when someone is hostile. Inappropriate affect is when a person is not having what you would deem the appropriate response to a situation. So if they should be angry, but they're completely calm, don't call 911, just keep an eye on them. Prohibited behaviors includes, but is not limited to, threatening or targeting another employee, fighting, harassment, and possession of a weapon. Off-duty conduct adversely impacting the ability to perform job or negatively reflecting on GDOT is also prohibited. You should know that the department has several post-certified investigators that are allowed to carry guns. These are the only people who are allowed to carry guns for GDOT. But also know that a weapon can be any object that is used to inflict bodily harm. So you as a construction worker might have, or an EO1, might have a machete at your use or at your availability to cut down weeds or brush. But if a person who has a cubicle has a machete, that would not be an appropriate tool. Also, a stapler can be a weapon if it's used to harm someone. So bear in mind, different things can be used as weapons. So how should you report workplace violence? You can always go to your supervisor or your district engineer. You can call employee relations. And if you feel like you are in imminent or immediate danger, please feel free to call 911. Let's answer a few questions. Billy and Dustin work on the survey crew together. They grew up as next-door neighbors and are basically family. Whenever they have a disagreement, the two of them have a history of settling it by wrestling it out, even at work. Because of their external relationship, this is not a GDOT issue. True or false? As you saw by the swirling false, that is indeed false. You're not allowed to fight at work, even if it's your family member. Paul and Tyrone are having a volatile argument about the use of a particular piece of equipment. At some point, Tyrone gets tired of the back and forth and tells Paul he better be quiet before he goes to his truck. This can be construed as a threat and fall under the workplace violence policy. Is that true or false? Well, if you said that's true, you are correct. Which of the following is not covered under the workplace violence policy? Bullying. My answers are being given away here a little bit. Sorry about that. misusing GDOT property, having weapons on GDOT property, or property damage. This particular issue of misusing GDOT property is not covered under the workplace violence property. It's not allowed, but it's not covered under the workplace violence policy. If you feel threatened, you should A, take affirmative action to get to safety, B, notify your supervisor, C, call 911, or D, all of the above. If you said C, all of the above, D, all of the above, actually, you are correct. If you have any further questions about any of these issues, please feel free to call Scotty Mathis, Kimberly Sever, or Beverly Nash. GDOT Standards of Conduct policy is covered under Policy 2255-1, and it reads, employees of the Georgia Department of Transportation are expected to maintain and exercise the highest moral and ethical standards in fulfilling their duties and responsibilities. Employees must conduct themselves in a manner that prevents all forms of impropriety, placement of self-interest above public interest, partiality, prejudice, threats, favoritism, and undue influence. Conduct which reflects credit upon the department and the state of Georgia is expected at all times from all employees. Employees must be alert in conducting business with employees and non-employees to avoid even the appearance of misconduct, personal or financial gain, or conflicts of interest. While performing department duties, employees are required to comply with federal and state laws, the Code of Ethics for Georgia Service, the Governor's Executive Order dated January 14, 2019, and all GDOT policies. So a couple of things about attendance. Just know that you are expected to be at work on time. And should you have a need to call in, your supervisor will determine the way that he or she wants to be contacted. GDOT does not have a standard call-in time, call-in policy, excuse me. Your supervisor will determine how they want to be contacted should you need to call them and let them know you're going to be late or that you will not be in for the day. Our Code of Ethics discusses the reputation of GDOT rests on all of its employees' shoulders. Our reputation is based on the principles of fair dealing and ethical conduct, and our customers expect a lot from us, as they should. We are beholden of the public trust, and it is a big responsibility. GDOT is dedicated to preserving that trust so that good judgment and high ethical principles guide you. And if you have any questions about that, please feel free to contact Employee Relations or our Ethics Officer, Matt Klein, who is also the head of administration. Conflicts of interest refers to situations where employees are in a position to influence a decision that may result in personal, self, or family gain. Do not use confidential information for your own gain or friends or relatives, etc. Also note that there are policies on political activity, the Federal Hatch Act, and outside employment. So if you know that there's going to be a road being built in your area somewhere and you know that that land is for sale, if you decide to go ahead and buy it so that you can then turn around and sell it at a higher cost for GDOT, that would be considered a conflict of interest. Conflict resolution. As a general rule, we would say that GDOT is a wonderful place to work, but there may be times when you're not getting along with someone or seeing things eye to eye with a coworker or a manager. In employee relations, we are trained in mediation and are here to help you resolve any personal or interpersonal conflicts that may arise. Feel free to give us a call. As a general rule, GDOT uses progressive discipline. We start with coaching if there's a behavior or performance issue, and then it moves up to a memorandum of concern, a letter of reprimand, and then a PIP a performance improvement plan, suspension, or demotion, and finally termination. Know that if you get an MOC, a memorandum of concern, that you are still in good employment standing. It's basically just saying, hey, we've talked about this before, and I still have some concerns about this particular aspect of your employment here, whether it's a performance issue or behavior. A letter of reprimand does take you out of good employment standing, and you will be out of good employment standing for a year. All and everything above that. Also know that there are times when an infraction warrants operating outside of these steps and goes straight to an LOR, a PIP, or termination. Also, the commissioner is the only person that can terminate someone. Know that you should come to work dressed appropriately for whatever your job is. If you are an equipment operator, that will be different than if you work in an office. All employees are expected to come to work clean and well-groomed. And within the offices, jeans are permitted on Fridays. Smoking is not prohibited in the buildings and should be reserved for smoking areas only. And please do not smoke in the GDOT vehicles as well. Employees should wear their agency ID unless it presents a safety risk. You will likely find that it's necessary to wear your ID anyway in order to gain access to buildings and floors. Conditions of employment include maintaining a professional, civil, and courteous relationship with coworkers and supervisors, maintaining courteous professional demeanor with contractors, contractor employees, GDOT employees, and the general public, provide clear and accurate information in a professional manner, use leave appropriately, including submitting timely requests and providing documentation for the use of leave when required, observe established policies on health, safety, security, and sanitation, including notifying supervisors of circumstances or situations that provide potential risks, and complying with instructions from all supervisors and managers. So here are some of the prohibited activities here at GDOT. This is not an exhaustive list. Every time we think we have thought of everything that can be done, someone invents something new. So here are just some of the things that you are not allowed to do while you're at work. I'll give you a chance to look those over. Please note that tape recording is not conversations is not allowed. It's an open records issue, and even though it's not illegal in the state of Georgia, it is against GDOT policy. The use of GDOT property should be reserved for conducting GDOT business only, which is to say that you are not allowed to use the copier to make copies of your church bulletin. You can't use the backhoe to grade your backyard on the weekend because no one's going to be using it anyway. Your email should be reserved for GDOT business. And the internet should not be used for searching for your next job, which we know you wouldn't want to do because you love it here. And certainly GDOT vehicles are for use only for GDOT business. Employees are responsible for reporting suspected criminal and administrative misconduct, including fraud, waste, and abuse related to the state programs in operation. Negligent use of state property or the destruction of state property is strongly prohibited. Here are a few questions for you. GDOT has a standard call-in procedure that every employee must abide by. Is that true or false? If you said false, you are correct. Your supervisor will determine how they want to be contacted. If you know GDOT plans to build a highway in your local area, it is fine for you to let your Uncle Junebug know so that he can buy the land in order to resell it and make a profit. Again, false indeed. That is actually not okay. You're running for sheriff in your local area. It's okay for you to pass out buttons and vote for me stickers at work. True or false? Actually, that is false. While we encourage you to run for state office, you may not campaign at work. Your manager writes you up for failing to report an accident in a GDOT vehicle, but you have no prior discipline in your file. It's okay for him to give you an LOR instead of an MOC. Is that true or false? That is absolutely true. There is no mandate that we go through every step of the progressive discipline ladder. 2 of your coworkers are involved in a dispute. EEO and ERS are investigating it and ask you if you know anything about it, but you want to stay out of it. It's okay for you to decline to participate in the investigation. Is that a true or false? That's actually false. It is a condition of your employment to tell the truth and participate in all investigations. Your wife's been on you for months to grade the backyard. You finally give in and borrow one of the backhoes from GDOT because it's over the weekend, no one will mind. Is that true or false? That is false. The insurance won't cover it too over the weekend. First of all, it's not yours. But second of all, if something happens to it, you can't replace it. If you have any questions, please feel free to contact Kimberly Suburb, Beverly Nash, or Scotty Mathis. Well, we want to thank you so much for deciding to join the GDOT family. Thank you for your wonderful participation in this presentation, and it has been my pleasure to welcome you to GDOT and orient you to employee relations. All the best. Good luck.
Welcome to the Human Trafficking Awareness Training provided by the Human Resources Administration Division of the Georgia Department of Administrative Services. This training provides you with an overview of human trafficking and how you can help prevent it. Hello, I'm Marty Kemp, and my family and I are honored to welcome you to this training portal. First, I want to tell you how deeply grateful we are for your service. Thank you for everything you do to make Georgia the best state to live, work, and raise a family. In January 2019, my family and I attended a human trafficking awareness event called Stop Traffic at Atlantic Station. It was an eye-opening experience for all of us, illustrating how many innocent people across Georgia are victimized by human trafficking.
That day, we watched 72 school buses drive around Atlanta to represent the 3,600 children sold into modern-day slavery each year, and we could not believe our eyes.
As a mother to these 3 smart, beautiful, and strong women, I knew that we needed to take action. We cannot allow this terrible criminal industry to plague our state, every community across Georgia, and take advantage of our most vulnerable.
Shortly after taking office, I signed an executive order creating the Georgians for Refuge, Action, Compassion, and Education Commission, what we call the Grace Commission. This commission is co-chaired by my wife, Marty, Speaker Pro Tem Jan Jones, and GBI Director Vic Reynolds, who are working diligently to end human trafficking in Georgia once and for all.
The Grace Commission has already made great strides in our work, but one of the most important lessons learned so far is that education is the key to prevention.
In our travels around the state, we've met with survivors and local leaders to see firsthand how this industry threatens children and young adults. The average age of a human trafficking victim is just 14 years old. Human trafficking exists in every county, but the victims exist in the shadows. With this training, you will learn how to recognize warning signs, notify the right people, and save lives.
We challenge you to take what you learn and share it with your family members, friends, and coworkers. Encourage them to join us in this fight.
Recently, I worked with the GBI to organize a training seminar for several campus organizations at the University of Georgia. We had leaders of 19 organizations attend the first training. Now, organizations have contacted us about scheduling another training.
All of these young women now have the ability to identify signs of human trafficking and better protect one another, because now they know that human trafficking can affect anyone. Thank you for taking this training. Together, we can end this evil industry in Georgia once and for all. Hello, this is First Lady Marty Kemp. I would like to welcome you to the Human Trafficking Awareness Training provided by the Human Resources Administration Division of the Georgia Department of Administrative Services. Join me in going through this training that will provide you with an overview of human trafficking and how we can prevent it. Human trafficking is a worldwide problem happening everywhere. Human trafficking includes different types of trafficking such as labor trafficking, sex trafficking, etc. After drug trafficking, human trafficking is tied with the illegal arms industry as the second largest criminal industry in the world today. It is considered the fastest growing illegal industry, generating $32 billion a year. Human trafficking is not limited to a certain demographic. It affects people of any nationality, age, social or economic status, or gender in every country of the world. While there is no official estimate of victims in the United States, it is believed the total is in the hundreds of thousands. Less than 1% of victims are identified and rescued. The state of Georgia is not exempt from this issue. Human trafficking occurs not only in our cities but across the state, including our suburban and rural areas. Consider the following statistics for human trafficking in the state of Georgia. The average age of a human trafficking victim in Georgia is 14.8 years old. 7,200 men purchase sex from a minor every month in Georgia. Approximately 374 girls are commercially sexually exploited in Georgia each month. Around 65% of men who buy sex with young females do so in and around suburban and metro Atlanta, with 9% near the airport. Atlanta has the highest number of trafficked Hispanic females in the nation. This training awareness presents you with helpful information for expanding your knowledge and awareness of human trafficking. However, the emphasis of this training will be in the sex trafficking type of human trafficking. The learning objectives include the following. Provide an overview of what human trafficking is, including the various forms. Provide examples of the groups involved in human trafficking. Provide a definition of sex trafficking and key indicators. Highlight the various ways for reporting human trafficking. Outline how you can prevent human trafficking in Georgia. As a state employee and as a citizen of Georgia, you play an important role in all aspects of Georgia business. It is for this reason that this training is now available to you to give you an understanding on how human trafficking affects our state and how you can be a piece of the puzzle that helps unravel this problem. Whether you are on the job or on your own time, you may witness behavior associated with human trafficking. Learning about this issue can help you make a difference. Human trafficking is the trade in people, especially women and children. The Department of Homeland Security defines human trafficking as a modern-day form of slavery involving the illegal trade of people for exploitation or commercial gain. Human trafficking happens every day in Georgia, in our cities, in rural areas, in suburban areas, in all zip codes. Since 2009, human trafficking has been reported in 145 out of 159 Georgia counties. There are two groups of human trafficking victims discussed in this training. The commercial sexual exploitation of children, or CSEC, is any situation in which someone under the age of 18 performs a sex act or is otherwise sexually exploited and something of value, financial or otherwise, is exchanged. This may include, but is not limited to, situations in which someone else, such as a human trafficker, benefits from this exchange. Key points in this definition are the following. The exchange of something of value. This is not limited to strictly cash transactions. It may include goods or services, such as food or a place to stay, in exchange for drugs or for someone else to receive drugs. Possible inclusion of a third party. Money or other things of value may not be received directly by the exploited child or retained by the child. The transaction may be brokered by or the money transferred to someone else, such as a human trafficker, relatives, or gang members. Sexual exploitation is not limited to overt sexual acts. It may include pornography, stripping, etc. Other related terms that are sometimes used include sex trafficking, child sex trafficking, and domestic minor sex trafficking. Sex traffickers use violence, threats, lies, debt bondage, or other forms of coercion to compel adults to engage in commercial sex acts against their will. The situations that sex trafficking victims face vary dramatically. Many victims become romantically involved with someone who then forces or manipulates them into prostitution. Others are lured in with false promises of a job such as modeling or dancing. Some are forced to sell sex by their parents or other family members. They may be involved in a trafficking situation for a few days or weeks, or may remain in the same trafficking situation for years. The following pie chart displays the various recruiting tactics used in human trafficking. It is important to note that over 50% are recruited by family and friends, the people they trust the most in their lives. Victims of sex trafficking can be U.S. citizens, foreign nationals, women, men, children, and lesbian, gay, bisexual, transgender, questioning, or LGBTQ individuals. The following pie chart identifies human trafficking victims by their ethnicity and gender. If desired, click here to pause the video. Vulnerable populations are frequently targeted by human traffickers, including runaway and homeless youth who begin as minors and continue through adulthood, as well as victims of domestic violence, sexual assault, war, or social discrimination. Sex trafficking occurs in a range of venues, including fake massage businesses, via online ads or escort services, in residential brothels, on the street, at truck stops, or at hotels and motels. The following news clip provides you with an example of what is happening in Georgia.
Teenage girl is safe tonight, and 4 people are under arrest charged with human trafficking.
Now, the girl told police that she was forced to have sex with multiple men in a hotel room in Marietta. Fox 5's Portia Bruner joins us live with the story. And Portia, how did police find the girl?
Yeah, really disturbing details here. They say it came from a 911 call from the 15-year-old girl. They say they are commending her for making that brave call yesterday morning. The allegations against these 4 sex trafficking suspects are as disturbing as they are heartbreaking. Marietta police say the young women and young men are charged with trafficking a person for labor or sexual servitude. And police say each one played a critical role in what allegedly happened to a 15-year-old runaway who called 911 from this motel off Northwest Parkway early Monday morning.
The 15-year-old stated that she had been forced to have sex with multiple men and that she needed help.
Officer Chuck McPhillamy says police arrived and rescued the girl who had managed to get out of the room to make the 911 call. He says detectives discovered the 15-year-old was held here over the weekend and feared she would be killed if she tried to escape. Warrants secured by Marietta police indicate 22-year-old Kamari Bolden did the girl's makeup in one motel room, photographed her and helped post pictures in online escort ads, then set up so-called dates for the girl to perform sex with unknown men for $80 in a nearby room. Warrants indicate 17-year-old Laura Waugh was photographed with the 15-year-old and offered to perform sex acts with the girl in online ads.
But the whole incident speaks to how courageous she was to be able to call 911 and say, I'm in this predicament and I need help.
22-year-old Kenneth Thomas is charged with pimping and keeping a place of prostitution from August 17th to August 20th. And 26-year-old Douglas White is being held on the same charges. Police warrants indicate he and Thomas worked together to recruit the 15-year-old, rent the motel rooms, and have 3 men show up to have sex with the 15-year-old on 3 separate occasions.
Piece all of that together, and that explains why we're charging them with human trafficking.
So I did get a chance to speak to management at the motel today. They declined to comment on camera, but said they do not condone what was allegedly happening at this motel, and say they reach out to police whenever they see any signs of what appears to be sex trafficking. As far as that 15-year-old girl, police say they have reached out to her family and that they are making sure that she is safe and out of harm's way. Reporting live from Marietta Police Headquarters, Portia Bruner, Fox 5 News.
Under Georgia law, a commercial sexual exploitation of children, or CSEC, victim is a child who has received food, drugs, money, shelter, or anything of commercial value in exchange for sex. Under Georgia law, children under 16 cannot legally consent to sex, and children under 18 cannot be willing participants in commercial sex. In a nutshell, regardless of how they act or appear, Georgia law recognizes these youth as victims of human trafficking and victims of child abuse. Many organizations have teamed together to fight human trafficking. It is possible to eradicate this problem by joining our force. Several government agencies partnered to tackle one of Georgia's biggest issues, sex trafficking. Our family attended the Stop Traffic event at Atlantic Station in January 2019. The hosts had one goal in mind: stop traffic to stop human trafficking. The event took a unique angle with its 72 school bus procession to Mercedes-Benz Stadium. This video from Stop Traffic provides you with sex trafficking victims speaking out on the dangers of sex trafficking.
Some people have no idea, but children are being trafficked every day in plain sight. It doesn't matter what your zip code is, what you drive, and where you live. Sex trafficking doesn't have a preference. And if parents need to be aware that what happened to me, it could easily happen to your child.
I hope that this opens people's eyes and lets them really see that this is happening around them. You know, when they see those numbers going by on the buses, they think of the kids in their lives. 72 buses equals 3,600 kids that are sold for sex each year in Georgia.
The children, we have to keep them safe by all means necessary, whatever measure it takes, to raise awareness, to make the traffickers so uncomfortable. They know they cannot come to the state of Georgia and pull that.
To people that feel like there's nothing they can do that would make a difference, I guarantee you could find something that can help. Everybody can find a way to help.
In this module, you will review the following topics. Who are the participants in the human trafficking crime? What is sex trafficking? Learning about the different types of human trafficking helps with identifying red flags in behaviors. There are 3 participant groups involved in sex trafficking. Human traffickers range from small-time one-person operations to unorganized networks of criminals to highly sophisticated criminal organizations. Human traffickers are not just the persons who pimp the victim, but any person who provides transportation, assists, or knowingly provides a room for human trafficking acts. A human trafficker can be anyone: a classmate, employer, family friend, acquaintance, a boyfriend or girlfriend, or someone you met online. Human traffickers often pretend to be someone they are not by setting up fake accounts online to friend teens and then groom them using a variety of techniques to gain their trust. Human traffickers entice people into sex trafficking and forced labor by manipulating and exploiting their vulnerabilities. Human or sex traffickers use the internet as a way to target unsuspecting and vulnerable youth for their own personal financial gain, as targets are seen as nothing more than a dollar sign. Human traffickers promise a high-paying job, a loving relationship, or new and exciting opportunities. In other cases, they may kidnap victims or use physical violence or substance abuse to control them. Human traffickers employ a variety of control tactics, including physical and emotional abuse, sexual assault, confiscation of identification and money, isolation from friends and family, and even renaming victims. Often, human traffickers identify and leverage their victims' vulnerabilities in order to create dependency. As a result, victims become trapped and fear leaving for various reasons, including psychological trauma, shame, emotional attachment, or physical threats to themselves or their children's safety. Victims are children who are used for sexual servitude or an adult who is used for sexual servitude through force, fraud, or coercion. It is impossible to end discussing sex trafficking participants without addressing the demand. The buyers create the demand. Buyers are the persons who pay for receiving goods and services from the victims. Human traffickers blatantly advertise their victims' sexual services with provocative photographs and unsubtle messages complete with per-hour pricing. The human traffickers pay online classified websites to display their messages. Sex trafficking is in some respects a hidden crime, but for the sex trafficker to make money, which is his or her ultimate goal, the human trafficker must obtain a stream of paying clients, or Johns, and provide an array of new victims. According to Human Rights First, the following descriptions of recent human trafficking cases in the United States demonstrate the wide range of industries where exploitation takes place. Some of these victims were subject to force and coercion, while others were lured through fraud and false promises. A group of 17 exploiters lured women and girls, one victim was 12 years old, with promises of love and wealth. FBI agents and task force officers staged operations in hotels and truck stops. The youngest victim recovered during the operation was 3 months old, and the average age of victims recovered during the operation was 15 years old. A male met girls online and convinced them they would have a better life with him. He supplied them with necessities and trafficked them to commit sexual acts. A father allowed his drug dealer to commit sexual acts with his children in exchange for crack cocaine. Let's review the definition of sex trafficking and look at the different types of sex trafficking crimes. Sex trafficking is a type of human trafficking for the purpose of sexual exploitation, including sexual slavery. A victim is forced in one of a variety of ways into a situation of dependency on his or her human trafficker and then used by the human trafficker to give sexual services to customers. In the United States, there are various categories of sex trafficking. Although this list does not include all categories, the 3 main categories reviewed in this course are very common as documented by survivors of sex trafficking. Human trafficker-controlled trafficking. Human traffickers pride themselves on tricking their victims into selling their bodies for money and thinking they have freely chosen to do it. Gang-controlled trafficking. At least 3 or more persons associated with the criminal street gang who work in concert to further a human trafficking enterprise. Family-controlled trafficking. Family could be parents, step-parents, aunts, uncles, grandparents, siblings, or cousins, often a form of domestic abuse that is passed down from generation to generation. In this module, you will review the signs of sex trafficking and how to report sex trafficking if you happen to see something suspicious. Is sex trafficking happening in your community? To be able to identify and assist, it is important to recognize the signs. Recognizing potential red flags and knowing some of the indicators of sex trafficking is a key step in identifying more victims and helping them find the assistance they need. Because sex trafficking is often a crime that is hidden in plain sight, it is important to be aware of its warning signs. Consider the following indicators exhibited by a person that may be a victim of sex trafficking, especially in the case of women and children, as established by federal guidelines for recognizing sex trafficking. Examples of poor physical health include the following. Show signs of poor hygiene, malnourishment, and/or fatigue. Has injuries or signs of physical abuse. Examples of lack of control include the following. Has few personal possessions and always wears the same clothes regardless of the weather or circumstances. Is frequently monitored. is not allowed or able to speak for themselves. A third party may insist on being present and/or translating. This video from Delta Airlines provides an example of the lack of control for sex trafficking victims.
Hey, sit down.
Sit down.
I have to go to the bathroom. Go with her. We're 2 minutes. What's that all about?
I saw them in the parking lot. I don't know what it is, but something's not right about that.
I think it's human trafficking.
You know, I thought the same thing, and I Googled human trafficking. Take a look at this and tell me what you think.
Never by yourself. Understand? Put it down. Let's go. Let's go. Get up. Stop. Go.
Examples of other signs or indicators include the following. Avoids eye contact and appears hesitant to talk to strangers. Claims of just visiting and inability to clarify where they are staying or provide an address. May have tattoos used to brand the victim as a member of sex trafficking. This video from Delta Airlines provides an example of how sex trafficking victims can display branding tattoos.
Hello, welcome to Delta. Now see your boarding pass and your identification, please. Thank you. May I see your identification, please? Thank you very much. How many bags will you be checking?
Just one.
If you'll place it on my scale for me, please.
Let's go. Help her.
What significance do those tattoos have?
It's personal.
Your baggage claim receipt, and thank you for traveling on Delta.
Let's go.
Keep in mind that this list is not exhaustive and represents only a selection of possible indicators. The red flags in this list may not be present in all trafficking cases. Take each individual indicator in context and not in isolation or as proof that sex trafficking is occurring. The following news clip provides an example of how to recognize the signs of sex trafficking in your community.
It is the nightmare next door that you don't even realize is happening. Human trafficking or sex slavery can happen anywhere in any neighborhood. Today, our Paula Tutman met a survivor who says there are signs you could notice and maybe help save someone like her.
So this is Wayne Road and this is Michigan Ave. I'm in Wayne, Michigan. And you can see there's a library down there. Little girl walked by that library to get to school. Her house isn't far from here. She says, looking in from the outside, people probably thought it was so normal. That household was so normal. But she also says that if neighbors had looked a little closer or been a little nosier, she might have been saved a lot sooner. Her name is Devon, and at 31 years old, she will tell you that a pimp doesn't necessarily wear a big hat with a feather. The pedophile is not just a 40-year-old man living with mom in the basement. Sometimes a sex trafficker looks like family. Her family.
I was sold at 12, almost 13, by my mother to my sister and my brother-in-law from Kentucky to Michigan.
From the age of 12, Devon grew up in this neighborhood in Wayne. She went to school, had friends, kept a secret. She was a sex slave.
My brother-in-law was selling me to men who would come to the home. From our house, I was going to school, I had friends, and I was still being sold from inside my home. Just by looking, we did look normal, but there were a lot of signs.
Lots of visitors at all hours, most of them men. When she went out to play, an adult hovered closely and never allowed her to speak freely. In fact, When she was questioned, the adults always spoke for her.
We had a privacy fence in the backyard, big thick curtains covering every window.
She wore long sleeves on the hottest days to cover bruises. She missed school to hide those bruises and breaks that couldn't be covered with clothing.
If you read through red flags, I exhibited a lot of red flags. But if you wouldn't know what to look for, you wouldn't have saw it.
Above all, she says neighbors should be nosy.
If you think something's going on next door, call the police. You know, it's better to be nosy and be wrong than be quiet and let someone be hurt.
How you react is an important component of how to solve this crime. What is important? Do not intervene. Engaging with human traffickers can endanger the life of their victims. Keep track of your observations. Note any signs or red flags so you can provide the most accurate information of the events, such as physical descriptions, number of people, any suspicious behaviors, etc. Observe any context clues, such as not allowing the victims to interact with others or allowed to speak to others, or any degrading treatment or controlling behavior. Here's what to do depending on your observations. Call 911 if it is an emergency or you see that the victim is in danger or his or her life is being threatened. That is, the victim needs immediate help. Don't be afraid to call and report something that you think is not quite right. You are trying to help. Text help or info to Be Free or 233-733 or call the Human Trafficking Hotline at 1-888-373-7888. If you need to add the phone number, pause the video. You can also download the See Something, Send Something app, which allows you to send a picture or written notes to the State Police Intelligence Center, where its credibility can be examined and referred to the proper law enforcement agency if necessary. If you need to download the app, pause the video. This video from Zoe International reviews the signs of human trafficking and how to report possible trafficking incidents.
Today, if you saw somebody chained to a post, you would do something about it. But in the days of the transatlantic slave trade, it was a normal sight to see. It isn't as clear today of what modern slavery looks like, but by knowing the signs of human trafficking, you can help protect yourself and you can help protect others. Traffickers would often brand their victims with tattoos, using words such as daddy or cash. Trafficking victims may show sudden changes of dress and behavior. They may suddenly have possessions that they usually can't afford. They may have unusually long work hours. Victims may have new relationships with boyfriends or girlfriends that are noticeably older, and I'm not talking about a few years. Difficulty with making eye contact, especially with men. Victims may have untreated medical problems, such as cuts, bruises, burns, broken bones. They may miss school frequently, make frequent trips. Victims may be unable to speak independently. Other people may insist on answering questions for them, or even translating for them. Victims may even be frightened of authorities, seeing them as the bad guys. To request help or report possible human trafficking incidents, please call the National Human Trafficking Hotline, 1-888-3737-888, or text info or help at Be Free 233-733.
As a public servant, you play an important role in all aspects of Georgia business. As such, you may encounter suspected cases of human trafficking in your own community. By teaching you to identify red flags and outlining steps for reporting human trafficking, You are now a trained eye working to stop this horrific crime. Georgia believes in the power of knowledge and is committed to the ideal that an informed public is its best asset. Awareness is Georgia's strongest tool. Know the signs, speak up, make a difference. For additional information on how to help, visit the Human Resources Administration Human Trafficking Awareness webpage on the DOAS website.
Hello, this is Alicia Wyatt. This presentation is pertaining to new employee orientation for human resources. This presentation will pertain to employees that are full-time, regular employees, not temps. This means that you work 40 hours per week and you'll be scheduled at least a regular schedule of 8 hours, 5 days a week. There are two types of classification. Your classification is unclassified, which should be in your job offer letter. Unclassified employees actually came about July 1st, 1996. Unclassified employees basically mean that you're employees at will, meaning you have no appeal rights if you become separated from employment. There are two types of employees as well, exempt versus non-exempt. Exempt means you're exempt from state comp time. You will get exempt means you will not receive FLSA, federal comp time. You will get state comp time. State comp time, there is a max, 240 hours. State comp time is basically hour per hour, meaning every hour you work over, you will get an hour of comp time. This is different from non-exempt. Non-exempt means you will earn federal comp time. The ratio for non-exempt is for every hour that you work over, you will get an hour and a half of federal comp time. Again, the max is 240 hours. All employees will have all their paperwork divided up into two files. One is the personnel file, two is the medical file. Due to the HIPAA Act that was about in 1996, medical files such as FMLA paperwork, the self-evaluation that you completed, any type of doctor notes, all of that will go into your medical file. Everything else will go into your personnel file. Permanent employees will be offered health benefits, flexible benefits. Also, you will have leave. We will discuss later in the presentation as far as the types of leave and how much leave. You will also be having deductions come out of your check or the retirement program, which we will discuss also later in the presentation. All employees are eligible to become members of the Georgia United Credit Union, GUCU. You can go online to gucu.org, or you can give them a call at 770-476-6400. Please look at all the different services that they offer. It's always a benefit to enroll. There is enrollment information online. If you need a paper application, please contact Human Resources. One of the three additional programs that also is given to permanent employees, State Charitable Contributions, SCCP. Every year, You'll receive emails and information that state employees can donate lump sum, or they can make arrangements for deductions to come out of their check, however much you wish to designate, but you can actually set that up on a continuous basis. Commute Smart, just information that we give employees in case they need to know information about alternate modes of transportation, albeit bus, train, carpool, vanpool. The third option, Employee Assistance Program. Every employee is eligible for FEI, F-E-I. This is a behavioral health. It is a hotline, as well as you can set up any type of counseling sessions that you and immediate family members may need. FEI deals in actual issues such as aggression, drug, alcohol, depression. The list goes on. If you or your immediate family members are in need of some assistance, please give FEI a call. They have counselors, psychiatrists. You can do one-on-one. You can even do group counseling. Every employee is given a break and a lunch meal. Lunch is 30 minutes or 45 or an hour long. You get 2 15-minute breaks to be taken periodically through the day. The breaks are paid for. Lunch is not, but you have to incorporate it all into your schedule. What do I mean? If you want to start work at 7 a.m. and have a 30-minute lunch, then your work schedule will be from 7 to 3:30. If you start at 7 and want a 45-minute lunch, then your schedule is 7 to 3:45. And for an hour, it's 7 to 4. The schedule is very important to get with your supervisors and come up with a schedule that works for you in the office. HR will reach out to you to find out what your work schedule is, because that needs to go on your time card. Your time card needs to state your schedule. It will keep track of any comp time that we discussed earlier as far as federal versus state. But in order for it to keep accurate records of how much comp time you earn, if you earn any, it needs to know your work schedule. Outlook. Anyone who has access to the computer will have access to Outlook. In Outlook, you will have a website that you would need to go to, myprofile.dot.ga.gov. You will need to log in to this profile to fill in the information in Outlook. Outlook will show your name, and Outlook will show the email address that IT creates for you. The information as far as your title, your business phone number, your location, that is for you to actually fill in. You will need to list this information so we in HR or payroll will be easily able to locate you and actually send you emails accordingly. Holidays. During the General Assembly, when they meet, January through March, also known as the legislative branch, during that time, they may not take off for a holiday. If they do not take off, state employees do not take off. The governor signed a proclamation saying that we have 12 holidays per year. But if a holiday occurs during the time the General Assembly is meeting, then it is moved to a different date. If we are off for a holiday, we're only going to be compensated 8 hours of pay. This will be equivalent to your hourly rate. If you work a schedule that is compressed, meaning 10 hours, or you work an alternate schedule, which is 9 hours, you will still only get 8 hours of pay on a holiday. 12 holidays per year. In order to be paid these 8 hours for the holiday, you must be in pay status before or after the holiday. What do I mean? You will need to actually be in pay status, meaning you either physically work or you need to have leave to cover your absence. If you don't work, you don't have leave to cover your absence, that is called leave without pay. If you are in leave without pay status, then you do not get the holiday paid to you. The 2020 schedule was given to you in paper form. If not, you have it here on the screen. The ones that are actually notated with stars, there's a state holiday in January. That was moved to November. So for Thanksgiving, you get 2 holidays back to back. Same thing with the second star, Washington's birthday. People call it President's Day. That's in February. The General Assembly does not take off for that holiday. So state employees do not take off for that holiday. It is moved to December. So for Christmas, you get 2 holidays back to back. All the other holidays within the year, 1 day here, 1 day there. You still get 12 holidays, but again, as you can see, 2 of them are moved. 1 to Thanksgiving and 1 to Christmas. If you are interested in a monthly card or a transit card, regardless if it's for Cobb County or Gwinnett County, please get in touch with payroll. They do have it set up where you can have automatic deduction for transit coming straight out of your check. Arrangements for any type of transit cards are made with payroll. To get in touch with payroll about this, please contact payrollgo at dot.ga.gov. Just a heads up, if you decide to have the deduction for the transit card come out of your paycheck, this will be on your paycheck that you will receive on the 24th. ESS, Employee Self-Service. There is a link on all computers that are hooked up to our server on the MyGDOT page. Per the pink arrow, it is pointing to Team Georgia. Has a little peach. When you blow that up, this is the Team Georgia website it will take you to. You should be familiar with this website. This is where a lot of people go to actually look at different advertisements for the state. I'm specifically going to be referring to the first pink slot, Employee Self-Service, My Account. Team.georgia.gov if you wish to get on the site from home or on your phone. But again, remember, we do have a link on our MyGDOT page. When you click on that link, you will need to sign in. It will take you to things such as your paychecks, your leave balances, your e-performance documents. You can look at your pay stubs to also see any type of deductions or benefits, personal information. When you change any personal information, just a heads up, you can go into ESS, Employee Self-Service, to actually make changes to your home address, your mailing address, your email address, your telephone number, your emergency contact. Personal items such as your name, your birth date, your social security. These are things that you will be able to view, but can't change yourself. It will be grayed out. You would have to contact Human Resources if you need such items changed. but you can change at your own convenience the other personal information, as far as your address and telephone number. Keep in mind, whenever you change your address, that information will feed over to different entities. Georgia Breeze, which handles flexible benefits, will receive your address change. SHBP, which is for state health, that will feed over to whichever health insurance you selected. It will also go to ERS, which handles your retirement. So please keep that in mind. If you change your address with us, we will be sending it out to these three entities. When is payday? Payday at the Department of Transportation is on the 9th and the 24th. We are semi-monthly, meaning 2 pay periods a month. We're also on a lag. What do I mean by a lag? Anything from the 1st through the 15th will be paid on a lag, payday being the 24th. Anything you physically work, any leave that you use between the 16th and the last day of the month, that's paid on a lag on the upcoming 9th. If the 9th or the 24th falls on a Saturday, Sunday, or holiday, all we're going to do is push payday up to the preceding business day. So if the 9th falls on a Saturday, payday will be Friday. If it falls on a Sunday, payday will be Friday. If it falls on a holiday and that holiday just happens to be on a Wednesday, then payday will be Tuesday. Just gets pushed up to the preceding business day. Speaking of checks, payday is the 9th and 24th. Your first check will be a paper check. Your first check will be mailed out to the address that you listed on your new hire paperwork. First check, along with it being mailed, is only for new hires. If you are a transfer from another state agency, whatever direct deposit information you have in the system should transfer to us. For all others, first check is a paper check and will be mailed on payday to whichever address that you have listed on your paperwork. Payday also for the 24th. As a reminder, the 1st through the 15th is what is paid on a lag on the 24th, but this is the same payday, the same check that your health insurance will be deducted from. For any time between the 16th and the end of the month, remember, we will be paid on a lag for the upcoming 9th. That will include any flexible insurance deductions. Flexible insurance meaning dental, vision, life insurance, short-term disability, etc. Any flexible insurance, all flexible insurances come from the same check, the one for the 9th, which pertains to the 16th through the end of the month. Now that you know that we're on a lag and we're semi-monthly, that means that there are 24 pay periods within the year, 24 checks between January 1st through the end of the year. So take your annual salary, divide it by 24, and you will have your gross amount. That's the starting point for every single check. You're going to start at this amount. Using the slide that you're looking at, if your annual salary is $30,000, if you divide that by 24, that means that your gross, each and every check will start at $1,250. Your net, your take home, is dependent upon any taxes and deductions that you sign up for. But your check will start off gross just by taking your annual salary and divided it by 24. Along with the 9th and the 24th, payday does not change when you terminate, regardless of the reason. So if your last day is on the 12th Your last day is on the 23rd. Payday does not change. Your last check will be issued on either the 9th or the 24th. You can submit your resignation letter, of course, to your supervisor or office head. Please ensure that HR receives a copy so we can make sure you receive your last check in a timely manner, as well as your leave payout check. These are two separate checks, last check and leave payout check. Your leave payout check will include annual leave, federal comp, not state. State is not paid out. So again, your leave payout check will include annual leave, federal comp, and or deferred holiday. Not everyone will receive deferred holiday, therefore not everyone receives a payout for deferred holiday. But if you have it on the books, it will be paid out as well. Parking at the OGC. If you attend meal at a facility, the One Georgia Center, parking is free. If you sign up for parking, monthly parking at OGC, you will need to fill out a parking form. You will need to email it to the OGC parking request inbox. It is here on your screen, but it is also on top of the parking form that you receive. You will be assigned to Lot B. Lot A is under the building, but there is a waiting list for that. You will be assigned to Lot B if you need parking at the OGC. Parking at OGC is optional, so you do not have to sign up for it. But if you do, please keep in mind that the cost is $40 a month. Parking comes out of the check that is issued on the 9th. So depending if you start on the 1st or you start the other pay period, which starts on the 16th, that will determine when your deduction is going to be coming out. So if you start on the 1st, you will have a full amount of $40 deducted out of the 9th check, as well as a full amount of $40 deducted on the 24th. Everything at GDOT is prepaid. So if you start in March, you would have to pay for March and April. You start in August, again, you need to pay for August and September. If you start on the 16th, that's half of the month. That means only half of a payment will come out of your check on the 9th, as well as a full payment of $40 for the upcoming month. You will need to list your own direct deposit information into the system. So again, you're on employee self-service. You will need to have the information as far as your routing number and your account number. A part of your new hire paperwork, all you signed was a form making you aware the direct deposit is mandatory. But you yourself will not be giving us a voided check, so we can enter your direct deposit information for you. You will enter it yourself. You will need your full routing number and your full account number to do so. Please also be aware of if this account is a checking account versus a savings account. When you view your check, you can see the amounts as far as deducted for taxes. But first, you will have to fill out your tax information yourself online. You will not be filling out a W-4. You will do that online. If you file exempt for state tax, That is the only time you will need to fill out a G4 tax form. Otherwise, you will be doing that tax as well online. The only time that you can file exempt is on paper. If you are going to list 14 allowances, that's on paper. Doing this online, you cannot file exempt or file 14 allowances online. Thus the reason for the G4 state tax form. So again, when you file your federal tax and your state tax, it will be online. The exception is if you file exempt or you have 14 allowances. This slide is for temporary employees. You will have money deducted from your check, 7.5%, that will go to GDCP, Georgia Defined Contributions Plan. Again, this is mandatory for temporary employees. This slide here is for employees that are transferring, that have been with the state for over many years. Your retirement plan will stay the same. Again, this is only for an employee transferring from one state agency to Department of Transportation, and you are currently in the new retirement plan. It will remain the same. All new employees go into GSEPs. That is an acronym for Georgia State Employees Pension and Savings Plan. That's a mouthful. That's why we call it GSEPs. All new employees go into GSEPs. It's a two-parter. You have defined benefit, meaning 1.25% will be deducted out of each and every check to go to your retirement plan, GSEPs. The other part is 401k. You are set up automatically to have deducted out of each and every check 5%. In this plan, in this GSEPs retirement plan, GSEPs does take matching, meaning GDOT will match your contribution 3%. The 3% though is on a vesting schedule. It's 20% for each year you are here as an employee. So by the 5th year, you're doing 100% match, meaning you contribute 5%, we will contribute 20% of that 3. That's for the first year. The second year, it goes up to 40%. The third year, it goes up to 60%. The fourth year, it goes up to 80%. So by you being an employee for 5 years, on that 5th year, it will then go up to a full 3% match. So by the 5th year, you present 5, we present 3. Until you get to that 5th year, it is on a vesting schedule. If you change your 5%, we will change our match. So if you only want to invest 4%, we will change our match to 2.5%. If you only want to have deducted out of your check 3%, then we will change our match to 2%. You have the option of either changing the amount, you have the option of actually coming out of the 401k completely. That is your option. You can increase, decrease, or totally void your 401k. You cannot change your defined benefit. That is your pension. That is mandatory. If you wish to opt out or change, please make sure you get in touch with ERS, the Employees Retirement System. Otherwise, the deductions will continue as is, 1.25% for your defined benefit or pension, and 5% for 401k. ERS has another savings plan called 457. You are not automatically enrolled in the 457. If you wish to enroll in the 457, you must get in touch with Peach State Reserves, which is a part of the employee's retirement system. It is just another savings plan. One of the major differences, if you have an early withdrawal, you will not receive a penalty. But again, for 457, for you to be enrolled in it, you must actually go and get in touch with Peach State Reserves, which is under the employee's retirement system, and actually sign up for the 457. Employees Retirement System, ERS, loves the magic number 30. That is what they base their retirement off of. If you work 10 years with the state, that means you're vested. So again, vested after you work 10 years with the state. There are 3 types of retirement. The normal retirement is what I mentioned, the 30 years of credible service. If you start employment with the state at 23, working 30 years is feasible. But let's say you start working for the state at 62. Working 30 years is not feasible. So a normal retirement is either working 30 years or you've worked at least 10 years, meaning you're vested, and you're either age 60 or up. Early retirement means you're under the age of 60. You didn't quite make 30 years. You have at least 25. But keep in mind for early retirement, for every year you're under, your benefit will be reduced 7% for every year. Keep that in mind. Terminated vested retirement, the last choice on the slide, that means that you worked at least 10 years, so you're vested, then you resign. You keep your money there with the retirement system. You keep your money in that plan. So when you turn to age 60 or up, you get moved and bumped up to a normal retirement. You did your 10 years, you quit, you keep your money there. So when you turn 60 or older, you can then request a normal retirement. The key is, again, you have to work physically 10 years. And 2, once you resign, you must keep your money in the plan. If you get a refund of any contributions in the retirement plan, all of these choices are no longer valid for you. They are no longer an option if you get a refund with the money you put into the pension plan. GSEPs, as a reminder, you have 2 things coming out of your check to go towards ERS. One is the defined benefit. One is the 401k. You need to state a beneficiary. If something happens to you while you're an employee at GDOT, the money that is being deducted out of your check needs to be given to your beneficiary. You need to establish a beneficiary. First, you need to go on www.ers.georgia.gov. You need to set up an online account, establish a username and password. While you're on the site, establish a beneficiary. So for a second, let's play a game. Who gets your money? Let's say you did not do anything as far as establishing a beneficiary. So if you pass away, who gets your money? The state. Let's say you did establish a beneficiary, your mother. You get married, but you never change the beneficiary over to your wife. So if you pass away, who gets your money? your mother. If you're married, you get divorced and get remarried. Yes, your money will go to your first wife or your first husband if you've never changed the beneficiary. Whoever you establish is who will receive your money. After you pass away, a relative or a friend cannot submit a will, a marriage license, a divorce decree, a life insurance policy to help determine who should get the money. What determines that is whoever you put down as your established beneficiary. You need to do this electronically online. All permanent employees, again, will need to have a schedule established. You will need to work 40 hours a week. By doing this 40 hours a week, you become eligible to accrue leave. Your leave will accrue 5 hours of annual leave, each and every pay period, so long as you meet the requirements of 40 hours a week. You have to physically work 40 hours a week, or you need to use your leave to cover your absence. But the amount needs to equal 40. And by doing so, you will accrue sick leave and annual leave. Let's take a moment. What is sick leave? Sick leave, you have a doctor's appointment. Your child has a doctor's appointment. You have to take your mother to treatment. You just don't feel well and called out sick. Annual leave means you need to get your car fixed. You need to have someone come look at your refrigerator. It's on the flicks. You need to go to the bank and establish some corrections that were made on your account. You're taking a vacation. These are all different definitions of annual leave. And again, each and every pay period, we have two, we're semi-monthly. Each and every pay period, you will accrue sick leave and annual leave. So the 1st through the 15th, if you meet the requirement, you'll get 5 hours of sick, 5 hours of annual. The 16th through the end of the month, you will get 5 hours of sick, 5 hours of annual. This keeps going on. As long as you meet the requirements, it just keeps building up and building up. It goes from one year to another. It will feed over. The only time your balance will go down is if you do not meet the 40-hour-a-week requirement, or if you take your leave, you take off, annual or sick. Otherwise, it stays with you on the books. There is a max of sick leave, 720 hours that you can accrue. And there is a max of annual leave, 360 hours that you can accrue. Once you reach that amount, you don't stop accruing. It's just any amount over that will go into a separate box called forfeited. Sick leave will never change. It will always be 5 hours each pay period, no matter if you work with us for a month or 50 years. Annual leave does vary. It varies by your hire date. So for the first 5 years, you will get 5 hours of annual leave. The next 5 years, you will get 6 hours of annual leave. And then the next 5 years and up, your accrual rate will go to 7 hours. So it changes from 5 to 6 to 7 every 5 years. And by the time you reach 7 hours per pay period, it stops. It will remain 7 from that time on. Now, the leave that I mentioned before, either over 360 for annual or over 720 for sick, goes into that box called forfeited. Forfeited leave can be used to go towards retirement. So therefore, if you actually work for a long time, you can use that to help you retire. 30 credible years, meaning physically you work 27 years and have 3 years of leave saved up. You could put the 27 and 3 together. Boom, you have your 30 credible years. When do you accrue this leave? Again, if you work the 1st through the 15th and you meet the requirement of 40 hours for the week, you will accrue on the 16th. 5 hours of annual, 5 hours of sick. You can use that leave on the 16th or after. If you work the 16th through the last day of the month, you meet the requirement of 40 hours, you will accrue on the 1st. You can use that leave on the 1st or after. When you take leave, you have two choices: CAS or sick leave. CAS stands for cascade. Cascade will go into a priority of leave. A priority meaning first, it will check your deferred holiday box. Second, it will check your FLSA box. Third, it will check your state comp time box before it finally gets to your annual leave. Or you can choose to use sick leave. Sick leave just comes from your sick leave box. So therefore, for example, you want to take 4 hours of cascade, 4 hours of CAS, but your deferred holiday has no hours. So it would automatically go to your second choice of federal comp time. You do have 3 hours in that box, so it will take it. Your third choice is state comp time. There is no hours in that box, so it skips over it. So by the time it gets to your annual leave, yes, you have a balance of 15 hours, but it's only needing 1 more hour to fulfill your request of 4 hours of cascade. So in reality, 4 hours of cascade equals 3 hours of FLSA and 1 hour of annual leave. That's how it came up to fulfill your 4-hour request. Sick leave, again, is just sick leave. You want to take 2 hours, 3 hours, 4 hours, it's just going to take 2-3 hours of sick leave. You're going to see other boxes on your time card: personal leave, court leave, military. They will all say 0. Personal leave, you have to have a balance of 120 hours to even be able to have that box show something other than 0. Court leave, can't use it until HR gets a copy of your court documentation, like jury duty. Military leave, we need your military leave orders in order to put any hours in that box for you. Again, when you take leave, GDOT works on a 0.25 increment system, meaning if you take 15 minutes, that's equal to 0.25. 30 minutes is equal to 0.50. 45 minutes is equal to 0.75. So again, using the example down at the bottom, if you work 8.5 hours, that is equal to 8.50. Or if you work 8 hours and 42 minutes, you're just rounding it up to 8.75. We are on the 15-minute increment system. Leave donations is available to employees. They have to satisfy all the criteria. One of the biggest criteria is, 1, they have to be here for at least a year. And 2, they have to be exhausted from all types of leave. Comp time, leave, forfeited, every single box that they have has to say 0. And the biggest catch, you have to be on leave without pay for at least 40 hours. Leave restoration is only for those employees that are rehired to the state and have leave left on the books when they left the state originally. The vested leave, they had sick leave on the books when they left the state originally. Again, this is for a rehire. Please remember again, your schedule needs to be on your time card, and you need to ensure you work 40 hours a week. How do you get to your time card? Again, you're going to go to the My GDOT page. This time, the green arrow is pointing to a clock that says WFTK. When you click on that, it will open up your time card for you, and you can fill it out accordingly. Temp employees, specifically interns, are given paper timesheets to complete. All other employees must fill out their time card electronically online. For NEO, you will have a project number that you're charging your time to. For however many hours you are a part of NEO, you need to charge that time to the NEO project number of AINT001. For all the other time that you work, regardless of what project that you're working on, you will get those project numbers from your supervisor or manager. But for NEO, if you're here a full day or a full 2 days, however long, that time needs to be charged to AINT001. Again, my name is Alicia Wyatt. My email address is awyatt@dot.ga.gov. If you have any questions about this presentation, please give me a call at 404-631-1501. Thank you.
Hello, my name is Barbara Pratt. I'm the Insurance and Risk Manager for Georgia Department of Transportation. I'd like to welcome you to the department and to the safety portion of new employee orientation. Let's start with our building evacuation process. The processes will vary depending upon where you're assigned within the department. If you are assigned to One Georgia Center, you're here at West Peachtree, North Avenue, Spring Street, and Linden Avenue. The evacuation route for exiting One Georgia Center will require use of stairwells A and B. They're located at opposite ends of each floor. You may take either to the bottom floor to leave through the emergency exits. Here we have an aerial view of the assembly area in the rear of the Varsity Restaurant parking lot. Our evacuation coordinators, along with the Atlanta Police Department, will direct your route through traffic to the rear of the Varsity parking lot. As you evacuate, follow the instructions of the coordinator. They'll have on orange vest and the authorities to the designated area. There you will find yellow signs held by your floor coordinators with the numbers that match your floor. Sign in with your coordinator and wait for further instructions. This will allow us to confirm the safe exit of every employee and visitor in the building with the proper authorities. Notify your coordinator ahead of time if you're unable to take the stairs. Procedures are in place for those with medical conditions. If you hear the fire alarm, but there are no flashing lights, wait for further instructions. The alarm is for elsewhere in the building, either on the floors above or below you. You may prepare, or you may want to wait for instructions. The emergency situation may be demolished without a need to evacuate. If you're uncomfortable waiting for further instructions, go ahead and proceed with the evacuation process. When you hear fire alarm and the strobe lights are flashing, we want you to calmly collect your gatherings and follow the evacuation route. Remember, do not attempt to use the elevator. Be sure to walk to the right of the stairwell as you're exiting and check in at the pre-established meeting site, which is at the rear of the Varsity parking lot. If the emergency is on your floor, calmly gather your belongings and proceed to the nearest exit when it's safe to do so. Before you exit, feel the door with the back of your hand. If the door is hot, do not open. Proceed to the other side. If that door is not hot, open it with caution and be prepared to close it quickly if needed. Should you encounter smoke, stay low to the ground by crawling on your hands and knees along the wall in the direction of the closest exit. The air is cooler and cleaner closer to the floor, and when possible, cover your nose area and try to avoid smoke inhalation. If there's no heat or smoke, immediately proceed to the nearest exit stairwell and calmly evacuate the building. Again, if you're unable to take the stairwell to the bottom floor for evacuation, notify your floor coordinator ahead of time so that proper arrangements can be made for your assistance. When the danger or risk lies outside of the building, consider the following for your safety. For tornado and hurricane warnings, seek shelter in the stairwells, restrooms, a closet, or other interior locations away from the windows. There's an earthquake, you want to crawl under your desk or a door frame, or locate other overhead protection from falling debris. Seek shelter areas prior to any event occurrence. Civil disturbance, you want to secure in your seat, remain inside, and wait for an all clear. For internal chemical attacks, seek shelter in the stairwell or interior suite as directed. And for bomb threats, remain inside of your suite and listen for further instructions. OCG has several notification systems in place. There are visual and audible alarms. There are smoke, water, and heat detectors. We have water sprinkler systems on each floor, and there are manual alarms. Safety evacuation coordinators are designated for each floor. Various alarms and signals used throughout the building and various departments in the fields to warn us against perils and hazards. In the event of an emergency, alarms are triggered at the security console first. This is located on the main floor at the security desk. All alarms and alerts start here. When notification devices are triggered, the property authorities are notified at first alarm. So most are en route at the time of our evacuation. Pre-recorded messages are available and can be heard on all floors. There are other safety systems in place at the OCG, like the pressurized doors in the stairwell. There's a backup generator on the 29th floor that provides emergency lighting in the event we have to exit the building. And if you're trapped in an elevator during an emergency evacuation, don't worry. The elevators are designed to return to the main floor lobby one by one. You may also pick up the telephone inside of the elevator to notify security and the authorities of your location, but do not panic. AEDs are located on every floor at GDOT. One more time. AEDs are located on every floor at One Georgia Center that GDOT occupies. We also have them available in the fields. Following this portion of the orientation, you will learn more about the Chemical Right to Know program, driver and vehicle safety, the driver check program, the license operator cards, reporting crashes and injuries, the State Safety Council review of preventable accidents, workers' compensation and return to work benefits, and there'll be several short videos for you to review for completion of the safety portion of NEO. Employee safety is our main focus. Safety professionals are designated to each district and local office. Your role is to start each day with a safety plan. Mentally prepare for the day, pre-inspect your equipment, scan your work area for hazards, and properly wear your safety gear. Follow the safety standards in your area. Our role when it comes to safety is to promote awareness, prevention, to educate, and to minimize risk. The current safety initiative is to think, look, and do. Proactive measures are needed to avoid work zone hazards and to ensure a safe work environment. Think about your work tasks prior to beginning. Look around for hazards in the area and do what is safe for both you and your coworkers. Emergency alerts are available for your GDOT cell phone and your personal. Okay, one more time. Emergency alerts are made available for your GDOT cell phone and your personal cell phone as well. These alerts are available by text, email, or voicemail. If you want to be promptly notified of traffic backups, dangerous weather, or other conditions, be sure to sign up for them on the GDOT webpage. We encourage the use of crosswalks in the area for protection and insurance coverage. Workers' comp will cover incidents during morning and afternoon travel and breaks. Personal insurance should provide coverage during lunch periods where there is no workers' compensation available. Atlanta Police Department and Midtown Blue police the area for our safety, which includes the use of cameras in the area. You are encouraged to leave your vehicles clean and clear of any valuables to avoid theft and damage to your vehicle. The Right to Know Act was passed in 1988 by the Georgia legislature. You have a right to know about hazardous chemicals in your workplace, to the information on its use, protection, and proper response if you're exposed. Now, according to OSHA, there are more than 32 million workers exposed to hazardous chemicals in the workplace. You should know what protective measures are available to prevent their adverse effects. GDOT offers online training for our Right to Know program. Training is required annually and the course takes approximately 15 to 20 minutes to complete. You will receive a certificate at the end of the session. You can sign up for it in AMS. It's very user-friendly and that allows us proof of compliance. You will learn more about the hazard types and the dangers of exposure. It talks about the corrosives and how it destroys living tissues on contact, the toxic fumes, what happens when you inhale or absorb them, flammable liquids, and reactive materials when they are exposed to one another. You will also learn about the requirements for the containers that house the chemicals. The stored containers must have labels and pictograms that communicate the hazard information. Safety data sheets for each chemical used will be readily available for employees upon request. All injuries and crashes are reported to the State Safety Office. We have found that distractions are at the root cause of many work-related incidents. Minimizing these distractions and direct focus on the task at hand should reduce our misjudged clearance and backing accidents, along with the physical injuries due to sprains and strains. Focus is the key to prevention. Backing accidents and misjudged clearance are currently the two highest categories for preventable vehicle crashes. We encourage the use of a spotter, which could be any passenger in your vehicle. Look for spaces that will not require you to back up. If there are none available, go ahead and back up upon arrival, and continuously check for clearance while operating vehicles or machinery. Failure to report a crash will result in disciplinary actions. Safety training is available free of charge for defensive driver training, CPR training, and use of AED. You may register for these in ELMS on the GDOT webpage. Driver certification cards are required for employees to operate GDOT vehicles or equipment. The certification cards are issued through the safety office and must be on the employee at the time of the use of the vehicle or the equipment. The card will be stamped for each piece of equipment the user is certified to operate. Contact a safety professional in your area for the operator forms. Driver check decals are posted on all state vehicles, including our GDOT vehicles. House My Driving stickers are on the rear of each vehicle, and it provides a number for citizens to call to report unsafe driver behaviors. Driver check helps identify unsafe behaviors and repeat offenders. The calls create a report online that is sent to the safety officer and the office managers. Points are assigned to drivers after repeated offenses. When reports are created, responses are required by the supervisor or manager within 10 days. Actions taken as a result of the complaints can range from coaching up to progressive discipline for habitual violations. What should you do if the driver check sticker is missing or defaced on your vehicle? Notify either your supervisor, your fleet manager, or local safety professional. How are the points assigned by driver check used? The points assigned are reported to the Department of Administrative Services for insurance purposes. Repeat offenses could result in additional training requirements
or increased insurance premiums. Traffic violations are sometimes captured on the cameras. Any citations given as a result of traffic violations will be the responsibility of the employee. State of Georgia drivers are insured for liability. The liability insurance is provided. State of Georgia drivers are insured for liability. The insurance is provided for authorized users of GDOT vehicles. Only state employees may drive state vehicles. Consultants may ride, however, there is no coverage available if a crash occurs. If you damage a GDOT vehicle or equipment with your personal vehicle, your insurance will be liable. The videos listed below are required viewing, and they will be posted again on. Auto liability coverage is available for the driver as long as GDOT business is involved. If you take the vehicle and run personal errands with no GDOT business involved, there will be no coverage available. Auto liability coverage is available as long as GDOT business is involved. If you leave the headquarters, meeting location, workplace, and go to have lunch or attend a meeting and you're involved in a crash, there is liability insurance available. For vehicle operators, we encourage you to inspect the vehicle prior to driving. Document any damages on the form provided. Focus on the road while you're out there. Allow yourself plenty of time to travel. Wear your seatbelts and use the 3 to 4 second rule following distance. Minimize your distractions and limit your phone use. Please, no texting. Prior to entering the vehicle, check for any dents or leaks. Check your tires, then test your lights, your wipers, and your brakes. Immediately report any deficiencies or damages to your supervisor or person in charge of fleet rental. You can be held accountable for undocumented and unreported damages if you fail to inspect your vehicle prior to driving. For vehicle crashes, immediate responses are necessary for reporting. Proof of insurance paperwork are located in the glove compartment. Be sure to assist the injured and call the police. Take plenty photos of the scene. Never admit fault and do not leave the scene prior to police arrival. Immediately notify your supervisor. Insurance reporting instructions are also located in the glove compartment, so immediately call and report your crash to the insurance provider and complete the investigation forms when you return to the office. Completion of investigation forms are required within 24 hours. The forms must be signed and dated. You'll have the employee statement. The supervisor must complete a statement, provide the photos, and a copy of the police report. These forms can be found on the GDOT website under the Safety tab, or you can reach out to your local safety professional. The State Safety Office receives information on every crash that occurs. The State Safety Council reviews each preventable crash on a monthly basis and provide recommendations for actions that should be taken for repeated violations. These action letters can be assigned and will remain in your personnel file for up to 3 years. Now we have workers' compensation and return to work. Workers' compensation is accident insurance provided by the employer for job-related injuries. The benefits are effective on the first date of employment at no cost to the employee. You're entitled to medical benefits, indemnity payments for lost wages. You'll be reimbursed for travel at 40 cents a mile. You have a return to work program, and death benefits are available to your dependent if needed. Okay, when injuries occur, you must immediately report them to your supervisor. If medical treatment is required, the claim will be reported to DOAS. Medical care will be arranged through the nurse case manager and claims adjuster assigned to your case. They're both assigned to assist you with your workers' comp issues during your recovery period. If there is no treatment required, then complete the investigation form for our files, and you should continue to monitor your affected area. When injuries occur, investigation forms are required within 24 hours. The forms must be signed and dated, and late reporting could delay your benefits. You'll have an employee statement. The supervisor must complete a statement. You must sign the leave election and doctor release forms. Once the forms are completed, go ahead and forward them to your supervisor and keep a copy for your records. These forms can also be found
out on the GDOT website under the Safety tab. If you're injured on the job, filing a claim is optional. And investigation forms are still required. Should you decide not to file a claim and to seek treatment with your personal physician, go ahead and indicate that on the employee statement, signed and dated. Now, we encourage you to use workers' comp benefits to eliminate any out-of-pocket costs. The group health insurance may not cover all charges for injuries that occur on the job, which could again leave you with out-of-pocket costs. Following each medical appointment, a work statement is required. It must be signed and dated by the physician. This would not include physical therapy visits. Employees are required to provide their supervisor or manager with a copy of the work statement as soon as possible following the appointment, by email, fax, or in person. Work statements are required before returning to work. The supervisor will forward a copy of the work statement to safety and the HR personnel. Employees should keep a copy for their records. Injured employees must use their sick leave for medical appointments, physical therapy visits, testing, etc. if the work release is for full duty or light duty work that can be accommodated. When lost time occurs, employees are entitled to lost wages if they're out of work for more than 7 days. As long as the time loss is approved by an authorized physician, you may use your sick leave with no interruption of your paycheck or your pay rate. You may use indemnity payments at 2/3 of your average weekly wage with no tax deductions. You may use your sick leave for a period of time and then use the indemnity payments for a period of time. Just specify the dates on the proper form at the time of your injury. Now, leave without pay may be required if you're out of work for less than 7 days and you have no available leave. Minor injuries must be reported to the supervisor. An investigation form must be created. The incident form will not be reported to insurance, but kept on file as a report only. The information will be readily available if the employee decides later that treatment is necessary. First aid kits are available on most offices and in the trunk of all GDOT vehicles. In emergency situations, treatment will be secured at the nearest medical facility. Be sure that your contact information is up to date in Outlook and in your personnel records. You have rights and responsibilities when it comes to workers' compensation. Information regarding this is in your handout and also posted in conspicuous areas on the boards along with the MCO panel and fraud notices. The information can also be found on my GDOT webpage under Policies and Procedures, Workplace Notices. Our Return to Work program is designed to safely transition an injured worker back into the workplace after an injury to maximize any potential for a full recovery. The Return to Work transitional process is as follows. After your medical visit, work restrictions are listed on your work status report. We take those restrictions and talk with your supervisor or manager to determine if we can restructure your task assignments to meet those restrictions. If work is available, then a transitional plan is created and discussed with you for your signature. Once you return within those restrictions, you'll be reassessed following each medical visit until you are either released to full duty or you reach the maximum time limit in the Return to Work program, which is 90 days. Transitional duty work provides modifications to your normal task assignments temporarily during your recovery process. Once the medical restrictions are lifted, the employee will return to the regular duty job of hire. Transitional duty permits the injured worker to remain active and productive during recovery, to remain in active pay status and continue earnings and benefits such as sick and annual leave and health insurance. You can continue to contribute to your retirement and savings, and it also eases the stress associated with lost work days. Transitional assignments will never exceed the medical restrictions. The AMA has confirmed that work is therapy. Medical research has shown that recovery accelerates when patients remain active and quickly resume their normal routine. Our Return to Work program personifies genuine interest in our employees' well-being and integrity when working with the injured worker to full recovery. The following videos are required viewing for completion of the NEO safety training. Upon completion, you will receive the proper credits. Thank you for your time and attendance. Here you have my contact information. I can also be found in Outlook for any questions or concerns. I have the State Safety Manager, Sharon Morales, and her contact information. Thank you for your time today.
Hi again. Thanks for participating in New Employee Orientation. I hope you found this presentation to be informative and you feel prepared to begin your career with the Georgia Department of Transportation. If you have any questions regarding the information shared today, please do not hesitate to reach out to the contacts provided. We're here to help. Tomorrow morning, you will report to your offices. Information regarding when and where to report will be sent to you individually. If you have any questions regarding that process, please let me know. Once again, we're delighted that you have chosen to work with the Georgia Department of Transportation. Welcome to the team.